Sandarkan lelahmu dan ceritakan tentang apapun aku mendengarkan.
Jangan pernah kau merasa sendiri. Tengoklah aku yang tak pernah pergi.
Bagiku engkau tetap yang terbaik. Entah beratmu turun atau naik.
Kadangkala tak mengapa untuk tak baik-baik saja.
Kita hanyalah manusia, wajar jika tak sempurna.
Saat kau merasa gundah, lihat hatimu percaya.
Segala sesuatu yang pelik bisa diringankan dengan
Kita perlu kecewa untuk tahu bahagia. Bukan terluka menjadikan kita saling menguatkan.
kadang-kala tak mengapa untuk tak baik-baik saja. Kita hanyalah manusia, wajar jika tak sempurna. Saat kau merasa gundah,
Lihat hatimu, percayalah.
segala sesuatu yang pelik bisa diringankan dengan segala sesuatu yang pelik bisa diringankan dengan
Halo semuanya, perkenalkan kami dari Sound of Nursing Poltekkes Kemenkes Semarang ingin mempersembahkan lagu yang berjudul Ampar-Ampar Pisang dan Takkan Menyerah. Silakan menyaksikan.
Apa yang kau tahu tentang semua yang akan terjadi? Tidakkah kau yakin pada dirimu? Angkat kepalamu, hidup tidaklah seburuk itu. Tiada waktu di mana kita sendiri dan sering merenungkan apa yang mungkin terjadi dengan hari ini ataupun nanti. Dan biarkan semuanya berlalu. Dan jika beban hidupmu takkan ada cara untuk bayar bersama anak rintangan kehidupan ini menjadi pemenang. There's no need to worry anything anymore. Everything will be fine as long as you're with me. There's no need to worry anything anymore. Everything will be fine as long as you're with me. Dan jika beban hidupmu takkan ada cara untuk bayar bersama anak rintangan kehidupan ini. Dan jika beban hidupmu takkan ada cara untuk bayar bersama anak rintangan kehidupan ini menjadi pemenang.
Poltekkes Semarang, mewujud impian, berjuta harapan, serta halalan. Beribu kampus di Nusantara, hanya satu yang istimewa. Usaha dan penghasil para negerian. Putra Indonesia.
Begitu syarat hal yang mungkin dan dapat kita perbuat untuk berbagi rasa, berbagi suka dengan cara yang mulia, wujudkan semua harapan ke dalam cipta dan seni. Mari berkarya dalam puisi dan lagu, musik dan tari. Layar merah panggung gerak adalah tempat kita sedunia. Ekspresikan diri, mari berkarya dalam puisi dan lagu, musik dan tari. Layar merah bergerak adalah tempat kita insan dunia. Ekspresikan diri. Poltekkes Semarang, wujud impian, berjuta harapan serta harapan. Beribu kampus di Nusantara, hanya satu yang istimewa. Pencetak para usaha dan muda, penghasil para cendekia. Wahai para pemuda bangsa, wujudkan Indonesia sehat. Poltekkes Semarang, wujud impian, berjuta harapan serta harapan. Dengan tangan dalam perbedaan, bersama kita cari masa depan. Melangkah maju, tetap bersatu dalam kebinekaan. Teruslah maju dan tetap bersatu bersama di Poltekkes Semarang.
semuanya, perkenalkan kami dari Sound of Nursing Poltekkes Kemenkes Semarang ingin mempersembahkan lagu yang berjudul Ampar-Ampar Pisang dan Takkan Menyerah. Silakan menyaksikan.
Apa yang kau tahu tentang semua yang akan terjadi? Tidakkah kau yakin pada dirimu? Angkat kepalamu, hidup tidaklah seburuk itu. Berjuang untuk semua hal yang berarti. Dan biarkan semuanya berlalu. Dan jika beban hidupmu takkan cara untuk menyerah. Bersama hadapi rintangan kehidupan ini, mencari pemenang. Pasti ada waktu di mana kita sendiri dan sering merenungkan apa yang mungkin terjadi dengan hari ini ataupun nanti. Dan biarkan semuanya berlalu. Dan jika berat beban hidupmu takkan jatuh menyerah. Bersama hadapi rintangan kehidupan ini, mencari pemenang. There's no need to worry anything anymore. Everything will be fine as long as you're with me. There's no need to worry anything anymore. Everything will be fine as long as you're with me. Dan jika berat beban hidupmu takkan cara untuk menyerah. Bersama hadapi rintangan kehidupan ini. Dan jika berat beban hidupmu takkan cara untuk menyerah. Bersama hadapi rintangan kehidupan ini, mencari pemenang. Ampar-ampar pisang, pisangku belum masak, masak sebiji di burung bari-bari. Ampar-ampar pisang, pisangku belum masak, masak sebiji di burung bari-bari. Masak sebiji di burung bari-bari. Mangga lepok, patah kayu bengkok, bengkok dimakan api, apinya campur lupa. Mangga lepak bengkok, bengkok dimakan api, apinya camcu lupa. Bengkok dimakan api, apinya camcu lupa.
Is going to start. Please turn on your camera and make yourself comfortable. Excellencies, distinguished guests, participants, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. His Excellency, the head of postgraduate program, Poltekkes Kemenkes Semarang, Assistant 1 and 2 of postgraduate program, Poltekkes Kemenkes Semarang, head of study program of postgraduate program, Poltekkes Kemenkes Semarang, and also all presenters and participants of the second International Health Conference with topic legal and ethical aspect of health services during pandemic. Ladies and gentlemen, let us begin today's session by saying Basmalah together. Bismillahirrahmanirrahim. Thank you very much for your coming on the second day of the second International Health Conference on legal and ethical aspect of health services during pandemic, hosted by Postgraduate Program Poltekkes Kemenkes Semarang in 2021. Today, we will hold a discussion with our invited speakers, and this session will be led by our moderator, Dr. Ariswondo, MPH. But first, please kindly allow me to introduce our moderator. Dr. Ariswondo, MPH, was born at Semarang on September 29, 1957. And his current position is an Assistant 1 of the postgraduate program of Poltekkes Semarang, and also as a senior lecturer in the Department of Occupational Health and Safety, Faculty of Public Health. And graduated in 1989. His last education is doctoral program in medical sciences, Diponegoro University, and graduated in 2009. As a professional doctor and lecturer, he has a lot of publication in both national and international journals. Ladies and gentlemen, without further ado, now please welcome our moderator, Dr. Ariswondo, MPH. To Dr. Ariswondo, MPH, the time is all yours.
Thank you, Ms. Taki, and also Ms. Raisa. Yeah, as she said that this is the second day of the International Health Conference. We have 4 expert speaker here. The first one is the Mr. Mardiono, MNS, PhD, and the second one is Dr. Sri Sumarni Amit. The third one is the Mr. Garot Mutiwibowo, and the fourth one is Dr. Bejo Santosa, SSI Kemenkes. Before we begin with this session, I would like to speaker that you only have 10 minutes of the for the presentation, and then after the first presentant, followed by the second and third and fourth. So this discussion session is and after this 4 speaker done. Okay, because of the limiting time, the first speaker, please, Mr. Mardiono, MNS, PhD. Yeah. Could you make a bigger? I cannot read that. Bigger one. Could you make a bigger? I can read. Terlalu kecil, terlalu kecil. Bisa dibesarin? Nggak bisa. Yeah, might be better if the if Mr. Mardiono can introduce yourself. Yeah, because I cannot read this CV. It's too small for me. Even I less. Okay. The first speaker, Mr. Mardiono. Time is yours. 10 minutes.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, thank you very much for opportunity to give some information about holistic nursing. I'd like to introduce myself. Lecturer in Health Polytechnic Semarang. I was graduated from Prince of Songkla University and currently for bachelor, master, and PhD in Prince of Songkla University. Originally, I am graduated diplomatry from it was Nursing Academy of Semarang. Nowadays become Health Polytechnic or Poltekkes Kemenkes Semarang. And then I also as the chief of Indonesian Holistic Nurses Associations since 2018, and now we try to help the Indonesian nurses to achieve the competence of holistic nurses. So that's why this morning I like to share the holistic nursing in cardiac patients in the hospitals. So we give information and competence of us practicing in the clinical settings. Okay. While preparing for the presentations, that Indonesian Holistic Nursing Association preparing some competencies such as basic holistic nursing and intermediate nursing and advanced holistic nursing. And some of the competencies very useful for improving nurses and caring for patients and not only in the hospital but also in the community. So this preparation or certification will be used for nurses to achieve the competencies and improving the quality of care in the clinical settings. Share screen, please. Yeah. Okay. Let's start the first. That I'm going to explain the part. First is a holistic human being, and the second is concept of holistic nursing, and the third holistic nursing and caring the patient in the hospital. I mean, cardiovascular patient in the hospitals. And first of all, we already know the human beings and holistics, including 6 aspects: biological, psychological, and psychological, cognitive, social, cultural, and spiritual. This already known that our aspect not only to concern about the biological, but also we should consider cognitive, social, cultural, and spiritual. Indeed, the human being, if we see from cellular angle, that to mention the nursings, we consider the deformity of the anatomic body, and then metabolism. We should also carry the acid basic, and then mineral, vitamins. Nowadays, we try to using the flavonoids and probiotic to improve the quality of care. And lately, we also using the enzyme, immunes, and then hormone. So this aspect will be useful to recover, to help the patient to heal. Now, come to the concept of holistic nursing. Mainly, we start from American Holistic Nursing Association, get us that all nursing practices has to goes to healing of the whole person is the holistic nursing. So we try to elaborate or try to extend the practices of holistic nursing in Indonesia, that all nursing intervention comprising of biological, psychological, cognitive, social, cultural, and spiritual aspect to achieve the harmony, not only the healing, but also harmony is fundamentals. Because in the healthy person, healthy people, patient or sick patients, we need to maintain the harmony, especially the psychological and spiritual. And and community also as a client in the holistic nursing. Now, concept in the holistic nursing, including first fasting, detoxifications, the contaminations, and then we are using the antioxidants, or we try to maintain the antioxidant intakes, and the most important is auto healings. I will explain in depth in the holistic nursing in the cardiovascular patient. Mainly or commonly we using concept of auto healings, and then adequate metabolism, substitution, psychoneurology, distraction. Of course, we also consider the psychological support, cognitive recovery, social support, cultural support, and the last one is important, spiritual healing. Holistic nursing in the cardiovascular, we try antioxidants to lower the profile lipid, including cholesterol, LDL, HDL, triglyceride, and then using the vitamin now, not only vitamin C and E, but also now we are familiar with vitamin D, preventing cardiovascular events. And then using the acupressure mainly to lower anxiety, pain, and then to achieve the quality sleep, and also to lower and decrease the fatigue and prevent the hemodynamic parameter constipation, because in the cardiovascular patient, constipation is not a simple problem, but maybe we need to overcome. In the chronic heart failure, acute coronary syndrome, and acute myocardial infarctions. Also, we use in the angiography procedure, pre and post cardiac surgery. And then now we explore the music, include in Indonesia, especially Morotal as music groups to lower anxiety, pain, and then to improve the sleep quality in the chronic acute coronary syndrome and acute myocardial infarctions. Now we also use the aromatherapy for lowering the anxiety, improve the sleep quality, and lower the fatigues. In Indonesia, we are familiar with the massage, and as usual to lower the anxiety, pain, and angiography procedure. Not only acupressure, now we also including the reflexology to lower the anxiety, pain, and coronary bypass or post-surgery. And we also explore using the spiritual emotional freedom technique. In the Europe, maybe familiar with emotional freedom techniques to decrease the anxiety, pain, and in acute coronary syndrome and acute myocardial infarctions. And then the Muslim country or Muslim patients, we usually use their own potential by using the dhikr, because most Muslim after every daily basis, they using the dhikr to decrease the anxiety and pain. So we can use in the acute coronary syndrome and acute myocardial infarction. Even though the pain is very high, however, in some people and some patients, it works. I think that's all that we try to give some explanation, and in further we can discuss how to apply in the clinical settings, and especially for Indonesian nurses, we have some certification. We hope we can achieve the basic, intermediate, and advanced holistic nursing. Thank you very much.
Thank you, Mr. Martino. Yeah. Okay, Dr. C. Sumarni, please, you also has the 10 minutes for presentation. Yeah, let me introduce the next speaker, Dr. Sri Sumarni. Address Kali PP, Budak Payung, husband, Mr. Nugroho, and she has 2 children. Education, Master of Midwifery at the Melbourne, and then doctor program at the University of Diponegoro, Faculty of Medicine. Organization with EP Jawa Tengah, assessor, is also chief of journal in Midwifery. Okay, next. Yes, that's the Dr. Sri Sumarni. Please, you can give the presentation about 10 minutes.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Is it my voice clear?
Clear.
Yes, thank you. Today is the big event for me that we are discussing about ethical approval in midwifery research. And the first that we have to know how important are the ethics in today's society. We know about that International Code of Ethics for Midwife has the big improvement in this midwifery atmosphere, because ICM has aims to improve the standard of care provided to women, babies, and families throughout the world through the development, education, and appropriate utilization of the professional midwife. So, in keeping for encompass the reproductive life cycle of the women from pregnancy through menopause and the end of their life. And the code is consisting of 4 aspects, that is midwifery relationship, and then practice of midwifery, and then the professional responsibilities of midwife, and the 4th is advancement of midwifery knowledge and practice. This one is adopted at Glasgow International Council meeting from 2008, and then reviewed at Prague Council meeting 2014, but right now is reviewed for 2020. We going through of this midwifery relationship, that midwife develop a partnership with individual women, and then support the right of women and families, empowering of women and families to speak from themselves on issues affecting the health of reproductive. It's also that midwife have to work together with policy and funding agencies. Midwife also support and sustain each other in their professional code. Midwife respectfully work with other health professionals and then recognize the human interdependency and responsibility to themselves as person of moral worth. For the aspect of the second, that is practice of midwifery, this one is focused on the providing care for women and childbearing families. Encourage the minimum expectation, and midwife use up to update evidence-based professional knowledge and also respond to the physiologically, physical, emotional, and spiritual needs. Midwife also act as effective role model of health promotion for women and family, of course. And midwife actively seek personal, intellectual, and also professional growth. The third is the professional responsibilities of midwife. We're going through to this slide because this one is a professionalism of midwife that they have to participate in the development implementation of health policies. The fourth that I have to focus on this is advancement of midwifery knowledge and practice. We make sure that midwife have the advancement of midwifery knowledge that is based on activities that protect the right of women as person. And also, midwife develop and share midwifery knowledge through a variety of processes such as peer review and research. And also midwife contribute to the formal education of midwifery. We are going through the research ethical principle that is honesty, objectivity, integrity, caution, openness, and then confidential, respect intellectual property, responsibility, publication, responsible mentoring, respect for others, social responsibility, equity without discrimination, competency, legality, protect of subject that's involving human and animal. So we cannot forget about the CIOMS 2016. This from Geneva 2016 that the CIOMS 2016 involving 25 guidelines. We can through here that is scientific and social value for respect for right, research conducted in low resource testing, equitability distribution of benefit and burden in the selection of the individuals and groups, potential individual benefit and risk of research, choice of control in clinical trial, caring for participant health needs, community engagement, collaborative partnership and capacity building for research, individual capability, modification and waivers of inform, collection and storage, and use of biological materials and related data consent. For guidelines number 12, that's collection, storage, and use of data and health-related research, reimbursement and compensation, treatment and compensation, as also research involving vulnerable person, adult, children and adolescent, women, pregnant and also breastfeeding women, disaster and outbreaks, randomized trial, online environment and digital tools, and also establishing research ethics committee, public accountability and conflict of interest. So we are talking in research ethic issues for midwife, also involving for three principle of research ethics: respect for autonomy, beneficency, efficiency, and also for justice. In relation to midwifery research, the midwife must act appropriately within the sphere of her role as registered practitioners. Why? Because they protect the right of the individual women to her no harm, and then obtain informed consent, respect her, and also as an agent of professional and moral justice. This one is informed consent. I think we can going through of this. And ethical approval during pandemic effect, that's depend on the design of the research cohort, experimental design, RCTs, and also place of collecting data. Is it community-based, clinical or hospital-based? And then the subject, is it the human or animal? Is it pregnant women, postpartum women, newborn baby, umbilical blood sample, tissue? And then what is the information? Is it from medical record, Internet of Things, biological material from previous research, or vulnerable participant? And also we have to talk also about reward and compensation. So what is about the systematic data review, where you get an ethical midwifery? So you have to go through health committee from hospital, institution. Thank you. 1 minute more. That's from Prospero. And this one is example of ethical clearance in Indonesia from Sultan Agung University, from Diponegoro University, and then from Poltekkes Semarang. And we can hear that effectively the ethic research or ethic approval is the last of the sentence from the method before the research. That's one I want to say and share here. Thank you so much. The last is a lesson learned from her that we have to know about the plagiarism, falsification, fabrication, conflict of interest, and cave authorship. Thank you so much and terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Sri Sumarni. This extraordinary presentation on the ethical approval in midwifery research during this pandemic. The next speaker is Mr. Gatot Murtiwibowo with the experience and learning teleradiology by generic workflow system for postgraduate student in diagnostic imaging. Yes, your time is also only 10 minutes. That's a limited time. And let me introduce her. Is graduated from the technology. My idol. Mr. Gatot, time is yours.
Thank you very much, Dr. Ari, for introducing myself. Good morning, ladies and gentlemen, and especially for all of my beloved students. In this occasion, I would like to share a short information about the teleradiology learning experience based on a developing model of the basic workflow that tailored for radiography students. I would like to talk about 5
or four maybe important things. And before starting my presentation, of course, I would like to introduce what is the teleradiology actually, and what is the opportunity for us or the scientists to develop the teleradiology that specifically designed for learning process that use for radiography student. And I also want to show you what is the method that we develop to create the model or a model that customized for learning process, which is the teleradiology information system. And also what is the results of our developing research about it. And finally, I'd like to give an introduction for the further research of our team. Basically, I'm not alone in this study, but also with my colleagues. So what is the teleradiology actually? Teleradiology is often defined as the electronic transmission of radiographic image from one geographic location to another location for interpretation and consultation of the image. Then the teleradiology basically was first developed for the military purpose in the United States, which was the X-ray field system that has capability to send the radiology image from a remote geographic location to the hospital at the home country for diagnosis and further patient management. Then the first commercial teleradiology system was introduced in the 80s, which was worked with the Kemenkes system. In the mid-80s, the first generation of teleradiology is embedded with PACS, were integrated, and installed in the system of medical environment that is for clinical use. The purpose of developing or the purpose of teleradiology technology can be divided into four aims. The first one is the system is to allow patient information to be available remotely. And the second one is to achieve greater accuracy, efficiency, and speed when it comes to the patient diagnosis and treatment. The third, or number three, the ability to share, or the system has the ability to share imaging easily and quickly that provides an accessibility of clinical information. And the last one of the aims is to facilitate the simple communication between physician and radiologist or any other specialist. So as we can see in this slide, this teleradiology works in a simple way. When we see in these figures, we have A figures and B figure, where, in the A figure, it is a local area network that's located at a distance from B land or local area network. We work at the local area network A, where we capture the image. For example, here we use CT scanner, and we save the image in a file of DICOM or video frame grabber, and we send into the LAN, A LAN. After that, we send or we transfer all of the data by wide area network to the local area network. So we can say that the AB is the teleradiology. You can see the image at the LAN A can be sent directly to the LAN B. Based on the information, we think that it is a challenge when we face the radiography student to study about the teleradiology in the real situation, because as you know, in the pandemic era, it is difficult to send students doing their clinical study in the field. So we think that we can develop a custom model where a student can study by their own in the lab or by using their own devices in or at home. We also try to do the literature review, and we found out some papers that explain about the teleradiology that also customized for specific purposes. But in this time, I just want to show you the study that has done by Amit Char et al. In this study, they did the teleradiology specifically used for the clinical needs in the hospital. How about the teleradiology that we want to do in our institution that purpose for our radiography students? So we did the research and developed a model based on the R&D model that's recommended by Bock and Gall. Bock and Gall recommended 10 steps to do the R&D, but we simplify into the six step. Sorry. And we use some materials and perform the method. The material can be divided into the hardware and software, as you can see on the slide. And of course, the method, we put the figure, as you can see in this slide. There are 3 stages of our research flow, which are the stage 1 is the preliminary studies, and the stage 2 is model development, and finally we step into the stage 3. And in the stage 3, we have to do the validation for final vision, and also in the next future we need to do the field test and also to assess the effectiveness and the quality of teleradiology that based on the web. Our results of our study, as can be seen on the slide, where we have the workflow model design. Basically, these 3 designs can be said as the module, okay? Say the module for open the application, and the second one, the module for viewing the image, and the last one is the module for sending the image. I have a video of the system, but later on I will show you if there is a limit time that's given to me. And this is the specification that we need to prepare, especially when we employ the sister meat. This is the specific name that we give to the product of our research. So we need to have the operating system, Windows 7, and the RAM 4 gigabyte, and so on. And importantly, we need to install the software, which are the Java, Exam, and Packs. What I mean is the open source. So what we can do for the near future, okay, basically teleradiology is one of the benefits that can reduce the morbidity and mortality. It is widely used in the health facility. How about for the education? So we did our research, but just a half part of our multi-year research, and we have the product that we say or we name the MTR, the CTER-MIT or Sistem Informasi Teleradiologi Medical Imaging Diagnostic. So I think that is the final slide, and in this slide, we would like to continue the research with the next step of the revision and field test and also the web quality test. I hope all of our studies will be benefit for the institution, especially in the Magister of Imaging Diagnostic, Poltekkes. In the conclusion, the application of teleradiology for learning radiography students, what we call SystemIT, has been developed and still needs final revision. That's all about my presentation. Thank you very much. I'll give the time back to the moderator. Time is yours.
Thank you very much, Mr. Garat Mutiwibowo. This is very informative and interesting topic. And at the end of this, his presentation, he challenged the student from the imaging diagnostic to do research on this area in this teleradiographic. Yeah, this is challenging. Okay, the next are the fourth presentation come from Dr. Bejo Santoso, SSIT Kemenkes, with the topic of dental and oral health policy during pandemic. Please, the IT, you can share it.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for the chance and thank you for the opportunity that you given to me to deliver my presentation about dental and oral health care policy during pandemic in Indonesia. As we know that the world has been suffering because COVID-19. At least 256 million positive case and 5.11 million death case, and Indonesia 4.2 million positive case and 143,000 death case until today. Many aspects has been changed after COVID spread around the world, especially in oral and dental health. But we shouldn't stuck here without doing something to avoid another problem like poor oral status. Today, we're going to talk about dental and oral health service program plan in Indonesia, and dental and oral health effort in Indonesia, dental and oral health service policy in Indonesia, dental and oral health service strategy, monitoring and evaluation of dental and oral health services, UKGS during pandemic, dental and oral health service during the pandemic. Dental and oral health program has clearly written on the National Action Plan for the Dental and Oral Health 2015 to 2020, and this is the integral part of Dental and Oral Health Service Roadmap 2015 to 2030. Dental and Oral Health Service Program in Indonesia also regulated in the Law of Indonesia number 17 of 2007 in the form of the National Long-Term Development Plan or RPGPN 2005 to 2025, which will be implemented in stage. In Indonesia, we have the National Action Plan specifically regulated about dental and oral health. The National Action Plan for Dental and Oral Health Services 2020-2025 focuses on strengthening policies, resources, and dental and oral health services in achieving A. The MFT of children aged 12 years reach 1.14. B. 75% of Poltekkes with good standard of dental and oral health program. C. 75% elementary school with UKGS stage 3. D. 50% of UKGM implementation at UKBM. Dental and oral health effort in Indonesia has been regulated by the Minister of Health of Republic of Indonesia number 89 2015 about dental and oral health effort. In Indonesia, generally, dental and oral health effort specifically focus to the object like dental and oral health of pregnant women, dental and oral health of children and adolescents, dental and oral health of the elderly, and dental and oral health service person with disabilities. The first, dental and oral health program of pregnant women. It is carried out integrated with maternal antenatal checks pregnant since the first antenatal visit includes health counseling in the form of providing communication, information, and education, oral health, early detection of dental abnormalities or disease, and refer pregnant women in terms of dental and oral condition need a curative approach. Second is dental and oral health services program for children and adolescents. Include dental and oral health service for babies, dental and oral health service for children toddlers, dental and oral health service for children aged preschool, dental and oral health service for children elementary school, and dental and oral health service for children in middle school. In school age, like from elementary school to junior high school, on the school there is a program called UKGS or School Dental Health Program. And advance is implemented in the form of activities like dental and oral health screening, dental and oral health education, dental and oral health checkup periodically, and advanced dental and oral health services. The third is dental and oral health of the elderly. Dental and oral health services for the elderly held in the healthcare facility or the other facilities that organize dental and oral community program or UKGM. Prioritize services with a curative approach and rehabilitation in the form of treatment and restoration of masticatory function according to the problem dental and oral health in the elderly. And the fourth is dental and oral health services program for persons with disabilities, carried out according to the growing past development of individuals with disabilities and or modification of the according to the type of disability, level of disability, and the presence of the absence of complications. Dental and oral health service policy in Indonesia has been regulated on the Law number 36 of 2009 concerning health, Article 93. Dental and oral health services are aimed at maintaining and improving the health status of the community in the form of: the first is improving dental health, the second is preventing dental disease, the third is treating the dental disease, the fourth, restoring dental health, and it should be done by the government, local government, and community carried out regularly, integrated, and sustainable. To improve dental and oral status, we should apply this strategy, such as increase promotive and preventive effort for dental and oral health services, increase accessibility to quality dental and oral health services, improving the quality of dental and oral health services, and increase stakeholder participation related to dental and oral health services. In implementing the program, we should see how far our program running and what kind of the problem found. That's why we need to monitor and evaluate all the program that we have done. From the central government stage, we should prepare our policies, norms, standards, procedure, and criteria for the implementation of dental and oral health programs. The second, we should carry out our socialization and advocacy to decision makers at the central, provincial, and district or city levels to support the development of dental and oral health services program. And the third, guide and facilitate the provincial health office in the development of dental and oral health service program. On the district or city health office stage, there are a person in charge of implementing the dental and oral health service program. Then fulfillment and distribution of dental and oral health personnel, and coordinate and provide guidance, facilities, and financing of community health centers in the implementation of dental and oral health services. UKGS during pandemic. What is UKGS? UKGS, or School Dental Health Program, is a health effort community aimed at maintaining, improving dental and oral health of students. The target schools supported by individual health effort in the form of curative effort for individuals who need oral health care. Because pandemic, there are many things should be adjusted, like public health care center should adjust the standard operational procedure of UKGS. The program should be follow the technical instruction of health services in the clinic at the time adapt to new habits that are already shared by the government at 2020. This is the look of the guidance book that shared by the Ministry of Health of Indonesia on 2020 about how to give healthcare services on the new normal period. And these are the implementation new normal services. On the picture, we can see the health provider should use personal protective equipment and the patient should use their mask until they take care of the treatment. On giving the services of dental and oral health during pandemic, there are three main things that need to be considered in dental and oral health services during the pandemic period. The first is prepare for service. That means wear a personal protective equipment, sterilize your room, tools, and the patient. The second is application of triage. Limit the patient by just accept the urgent patient to reduce contact and interact with others. And the third is the application of physical distancing. Arrange the room and keep the distance by 1.5 meters in the waiting room. On giving oral and health services during new normal, we have to consider a few things like the first is the position of dental unit is set with the patient's head in the direction enter the clear air stream, which is located behind the dentist towards patient and inhaled with an exhauster placed 20 cm from the floor as a sucker for little air. The second, applying the concept of four-handed dentistry, where dentists are assisted by assistant who can carry out suction and rubber dam procedures to minimize droplet and aerosol splashing. The third, use the high-volume saliva ejector as high-volume evacuator and a suitable rubber dam. The fourth, additional medical device for aerosol management can be vacuum aerosol tool and wrapping box or aerosol box. Fifth, ask the patient to gargle with 1.5% hydrogen peroxide or povidone 0.2% before treatment. Sixth, for pediatric patient or adult patient who cannot gargle, always use a rubber dam. For all surgical procedures generate aerosols, rinse before treatment should be replaced using a cotton roll as it may be difficult for the patient to rinse properly. 7. Avoid using ceiling fans or air conditioner or in front of the dental unit where the one direction is from the patient to the operator. When carrying out the procedure, it is advisable to place a fan or air conditioner behind the operator and let the airflow to the patient. 8. Disinfect the room after taking action dental procedure before entering the patient. 9. Limit the number of people in the room during the procedure of action is carried out. It is recommended not to wait for adult patient enter the dentist office. The first picture shows us to use the rubber dam and saliva ejector as HVA, and the second picture is show us how to use of the vacuum aerosol and wrapping box.
Thank you very much, Mr. Bejo Santosa. Yes, that's a very interesting presentation. Yeah, at the end of his presentation, is also mentioned about the protocol for serving dental therapy. Yeah, because this is very important for dentists and dental therapists. Yeah, during this pandemic. Okay. Fourth speaker has done their presentation, and now our distinguished participant, you can ask the question, and then you should specify which speaker do you ask for. Okay. The chat room, is there any question? Bu Marni, Pak Mardiono, Pak Adat, is there any question on the chat room? Yeah, okay.
I'd like to give some additional informations about the auto-healing potential in holistic nursing. Mainly, I already explained about the symptoms management such as pain, anxiety, fatigue in the cardiovascular patient, either the acute coronary syndrome or acute myocardial infarctions. Now we try, and the development of the holistic nursing interventions, we try to using the concept of the auto healings that not only to reduce the symptoms, but also try to maintain or maybe can normalize the dysrhythmia, this particular symptom in the cardiovascular events. And other things I explained before, the cardiac events, like the increase of the cholesterol, and then LDL or triglyceride. This mainly to make a worse in the cardiovascular patients. And the other thing that cardiac events we can manage by using the acupressure mainly. The important thing that why the acupressure can be used as a concept of auto healings means that not only the drugs to make a normalize the function of the heart, either in the arterial or in the heart function or cardiac output functions, but also to normalize the metabolism or the function or the function of the cardiologist, especially the heartbeat. And the other thing, cardiac event can be managed by reflexology. Now we have foot reflexology and then hand reflexology, and the last one we call sujo, maybe mainly from Korean. They develop some, actually basically based on the meridian intervention by using the meridian points, but the name of the sujo combined with the color or other things, and it's very related to the hand reflexology and the function, not only in the symptom, in the anxiety, pain, fatigue, but also in the cardiac rhythm, such a rhythm of the heart and the hemodynamics, especially the heart rate and then blood pressure. But the challenges in the future, especially in the acute coronary syndrome or acute myocardial infarction, when the patient develop the clot, we try to using the alkaline water or to maintain the acid base to dilute the clot in the vessel or in the arterial. I think that's all for additional explanation, because the concept of auto healing we may not familiar yet, but in the future we will using the potential technique or concept. This one. Thank you very much.
Thank you. Do we still have a time? Yeah, because Mr. Gatot more information for 2.5 minutes. Do we have still have time? Okay. Yeah. It's also Dr. Mani.
Thank you. I just want to do my closing statement that I would like to emphasize and conclude of my presentation that get your ethical approval smoothly before collecting your data, so you will get your great research and deliver your publication running well. That's all. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Mr. Gatot, please 2.5 minutes. Okay.
Well, thank you very much. I think what we can emphasize based on my presentation, the student can use the model of customized teleradiology in our lab by means of using your own devices in your hometown, or you can come here and use it. And I think I would like to show you the short video about it. Hopefully it works well. Sorry, the connection is not good, so maybe later on you can see the video or request to me about that video. Thank you very much, sir.
Thank you, because of the internet signal. Yep. Yes. This is all of the for presentation. Yeah, I would say thank you. So many thank you for those presentation. That's very interesting for us. Hopefully, this is useful for developing our work or job next to this session. Okay. Yes. We will give the certificate for each Okay, thank you. That's all for this session, and I'm give to your MC. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Dr. Ari. What an excellent presentation for our keynote speaker. Sorry, invited speaker. Excellencies, distinguished guests, participants, ladies and gentlemen. Those are the subjects we had from the amazing speakers and moderator for the second day of the second international conference with the topic legal and ethical aspect of health services during pandemic. Coming up in a moment, we are going to invite you all to join the parallel session. For those who will join the presentation session, please note that our session will start at 9:30. All presenters will be divided into 7 breakout rooms regarding the paper scopes. For room 1 is for nursing. Room 2 and 3 are for midwifery. Room 4 is for diagnostic imaging, and room 5 to 7 is for oral health therapies. And for the audience, feel free to select your breakout room. You can choose any room that you want. And let me remind you again that the link of the attendance will be distributed through the chat box toward the end of the conference. So please make sure you follow the whole series of activities to get a certificate. So please be ready. And if you have problem joining the breakout room, please do not hesitate to ask the committee directly or via chat box. With our pleasure, we will help you. So enjoy the conference.
Begitu banyak yang ada di hati menanti terkuat, ingin mengungkapkan dan mencurahkan berbagai rasa dan kesan tentang kehidupan. Begitu syarat yang ada di benak menunggu tersirat. Ada segala cara dan berbagai jalan untuk mewujudkan hasrat di hati, hayalan ke dalam cipta dan seni. Mari berkarya dalam puisi dan lagu, musik dan tari. Layar merah penggerak adalah tempat kita, insan dunia. Ekspresikan diri. Begitu syarat hal yang mungkin dan dapat kita berbuat untuk berbagi rasa, berbagi suka dengan cara yang mulia. Wujudkan semua harapan ke dalam cipta dan seni. Mari berkarya dalam puisi dan lagu, musik dan tari. Layar
wujud impian, berjuta harapan serta halangan. Beribu kampus di Nusantara, hanya satu yang istimewa. Pendeta para usaha dan muda, penghasil para cendekia. Wahai para pemuda bangsa, wujudkan Indonesia sehat. Poltekkes Semarang, wujud impian, berjuta harapan serta halangan. Bergandengan tangan dalam perbedaan, bersama kita cari masa depan. Tetap maju, tetap bersatu, langkah bineka, teruslah maju dan tetap bersatu. Bersama di Poltekkes Semarang.
Halo semuanya, perkenalkan kami dari Sound of Nursing Poltekkes Kemenkes Semarang ingin mempersembahkan lagu yang berjudul Ampar-Ampar Pisang dan Takkan Menyerah. Silakan menyaksikan.
Apa yang kau tahu tentang semua yang akan terjadi? Tidakkah kau yakin pada dirimu? Angkat kepalamu, hidup tidaklah seburuk itu. Berjuang untuk semua hal yang berarti, dan biarkan semuanya berlalu. Dan jika beban hidupmu, takkan cara untuk menyerah. Bersama hadapi rintangan, sendiri dan sering merenungkan apa yang mungkin terjadi dengan hari ini ataupun nanti, dan biarkan semuanya berlalu. Dan jika berat beban hidupmu, takkan jatuh bayang bersama anak rintangan kehidupan ini menjadi pemenang. There's no need to worry anything anymore. Everything will be fine as long as you know me. There's no need to worry anything anymore. Everything will be fine as long as you know me. Dan jika berat beban hidupmu, takkan jatuh bayang bersama hadapi rintangan kehidupan ini. Dan jika berat beban hidupmu, takkan jatuh bayang bersama hadapi rintangan kehidupan ini menjadi pemenang. Hampar-hampar pisangku belum masak, masak sebiji di burung bari-bari. Hampar-hampar pisangku belum masak, masak sebiji di burung bari-bari. Masak sebiji di burung bari-bari. Mangga lepok, patah kayu bengkok, bengkok dimakan api, apinya campulupan. Mangga lepok, patah kayu bengkok, bengkok dimakan api, apinya campulupan. Bengkok dimakan api, apinya campulupan.
bari-bari.
Sandarkan lelahmu dan ceritakan tentang apapun aku mendengarkan.
Jangan pernah kau merasa sendiri. Tengoklah aku yang tak pernah pergi.
Bagiku engkau tetap yang terbaik. Entah beratmu turun atau naik.
Kadangkala tak mengapa untuk tak baik-baik saja.
Kita hanyalah manusia, wajar jika tak sempurna.
Saat kau merasa gundah, lihat hatimu, percayalah.
Segala sesuatu yang pelik bisa diringankan dengan kita perlu kecewa untuk tahu bahagia. Bukan terluka menjadikan kita saling menguatkan.
Kadang-kadang tak mengapa untuk tak baik-baik saja. Kita hanyalah manusia, wajar jika tak sempurna. Saat kau merasa gundah,
Lihat hatimu, percayalah.
segala sesuatu yang penuh bisa diingatkan dengan penuh. Segala sesuatu yang pelik bisa diringankan dengan penuh. Begitu banyak yang ada di hati menanti terkuat, ingin mengungkapkan dan mencurahkan berbagai rasa dan kesan tentang kehidupan. Begitu syarat yang ada di benak menunggu tersirat untuk dalam cipta dan seni, mari berkarya dalam puisi dan lagu, musik dan tari, layar merah penggerak adalah tempat kita. Begitu syarat hal yang mungkin dan dapat kita perbuat untuk berbagi rasa, berbagi suka dengan cara yang mulia, wujudkan semua harapan ke dalam cipta dan seni. Mari berkarya dalam puisi dan lagu, musik dan tari.
Recording in
And
progress.
finally, thank you very much for this opportunity.
Thank you very much, Nabila Pramitya Putri. This wonderful presentation. So we are waiting any participant. If there is any question, just type in the Q&A chat box. So if there is no question, then I will give chance to Dr. Sudiono SAMKes to give insightful feedback as a reviewer. Time yours. Thank you.
Thank you, Pak Gatot. Congratulations, Nabila Pramitya Putri. Yeah, wonderful presentations today. Congratulations for you and your team. I have a question to you. Why you using the TB case in your research? Nabila.
Thank you for the question, Mr. Dion. I use these TBI cases in my research is because based on World Health Organization, the TBI cases is one of the causes that can cause mortality and morbidity in worldwide. So thank you, Mr. Dion.
Okay, thank you. It's more better that your presentation maybe give information about how safely the TBE case is. I think it's good if you see that and how many accidents in Indonesia may be, and what are risks if the treatments not immediately taken.
So maybe Nabila Pramitya Putri, let me have to rephrase what our reviewers just saying. So reviewer give you an insight. The first is you have to adding the severity rate. Jadi tingkat kefatalannya. So you have to input in your papers. Is you have
Recording in
Slide,
progress.
I know that you take the research by literature review, right?
Yes, right, sir.
Okay. How do you get the seven article of this research?
Thank you for the question, Mr. Dr. To know how I get this literature review until I get the 7 article is based on inclusion and exclusion criteria that I select. Inclusion criteria is the full text article. This full text article is complete with DOI, or we can say the digital object identifier, that contains the title, name of the researcher, publisher, year of publisher, and complete article contents up to the bibliography. And then the second inclusion criteria is original article. This article is published in 2011 until 2020.
Recording in progress.
The example is contains the abstract, and then the articles of journal reviews of duplicate articles, and then the articles that unpublished repository with national or international, and the articles that don't yet have a digital object identifier. Thank you.
Thank you. On to select article, maybe more better that you saw the selected by like Alur, yeah. You know that the selection do you can you use this selection your article? Okay. Remember the selection of this article may be more better that you using the maybe called the Prisma. Okay, thank you, Pak Nabila Pramita. And the next slide and the fourth slide, maybe I have you explain us about the summary of your article. As we know that the literature review is not a summary article, so it's important if the literature review maybe you enough give us the table of extraction data, yeah, maybe like that. So attendant or ask know about your overall of your article. Okay, the next question for you and maybe your team. The conclusion of this research, you say that the 5 millimeter slice thickness more better than 1.2 slice millimeter slice thickness using in the TBI, right?
Right, sir.
Okay. The question of this statement, why do you consider that 5 millimeter slice thickness more better than 1.2 millimeter in the TBI case? Can you explain?
Yeah. Okay, thank you, Dr. Sudiono. The implementation of this slice thickness is basically according to the use. A 5 millimeter slice thickness is good to use for TBA patients that accompanied by subdural hematoma and etc. because the image will look softer, not too much noise. So for evaluate the brain parenchyma is will be more informative. But if we use this 1.2 millimeter slice thickness, it's good to use TBI patients that accompanied by maybe fractures in the base skull, and by using the bone window, the small fractures that are not visible in the thicker slice thickness will appear more clearly with using of 1.2 millimeter slice thickness. That's all, Doctor.
Okay, thank you. The next one, the conclusion of this. Oh, sorry.
Sorry, Pak Sudiono. Maybe we can continue discuss in another sessions of discussions between you and Nabila Pramitya Putri, because we have another 8 presenter, but we have to stop at 11:30.
Sorry. Thank you so much.
But in summary,
thank you.
Sorry, Pak.
Okay.
So, but in summary, another insight from reviewer to Nabila Pramitya Putri is also at the same time answering the question from Julie Ponco Wiono at the chat box. Okay, he is asking to you basically what that slice thickness of 5 mm is optimum and who determines that. So actually, also answer Julie Ponco Wiono that 5 mm is only based on literature review. Many sources can be 1.1, 1.5, 1.2, 2 mm, 3 mm. But this paper, as my understanding, based on the literature review. Am I right, Nabila Pramitya?
Yes, right, Mr. Gatot.
Okay, the second is the 5 mm slice thickness is only optimum for subarachnoid bleeding. Am I right?
Yes.
Maybe another clinical indications for 5 mm in your paper?
Usually, these TBI cases is accompanied with skull fractures. Then the skull fractures is developed in subarachnoid bleeding, then extradural hematoma, and etc. until ODIM.
Okay, so to all participants here, so just want to clarify that based on the literature review done by Nabila Pramitya Putri, so the review, the literature is suggesting you to have the 5 mm slice thickness for the traumatic brain injury for the skull fracture, because the skull fracture will lead for the subarachnoid bleeding, extradural hematoma, and also edema. Okay, so just be specific that 5 mm is related with skull fracture and subarachnoid bleeding. Am I right, Nabila?
Yes, also all right,
Okay.
Mr. Gatot.
Okay, thank you very much, Nabila Pramitya Putri. And next, we will have a symbolic granting of certificates. So please asking help to Astri to show the certificate, please. Okay. Okay. Congratulations to Nabila Pramitya Putri for the first presenter today. Thank you very much and congratulations. So let me continue the discussions for the second presenter. I call Calvin Halim. Is it Calvin is already in the line of Zoom meeting?
Yes, Mr. Gatot.
Okay, so the Calvin Halim will deliver the paper presentations, volume measurements analysis of bleeding in the phantom with dual source computed tomography DSCT in RSUPN Dr. Cipto Mangunkusumo. The time is yours, Kevin, for 10 minutes, please.
Oh, okay, Mr. Gatot, thank you for the time. Good morning, all participants. Okay. I can operate my slides by myself.
Yes, please. So, Astrid, please just give the access to Calvin to host the meeting, please.
Can share, sir. Okay.
Okay. Thank you for the time, and thank you for all participants. Thank you for.
Sorry, Calvin. So I still cannot see clearly your slide. Can you just maximize the slide, please? Slideshow, please.
Okay. Mr. Gatot, can Mr. Gatot?
Yes, I'm here. If you have the challenge to show the slide, then you can send to me or send to committee. Then we will show your slide.
Okay, I send to committee.
Okay. Astrid, just let me know if you receive the file from Calvin, then for presentations, Astrid.
Yes, sir.
Are you receive it?
I send.
Yes. Okay. Okay, Calvin, time is yours for maximum minutes.
Okay. Thank you for all the participants. My name is Kelvin. I am the my paper title is volume measurement analysis of bleeding in phantom with dual source computer tomography in RSUPN Dr. Cipto Mangunkusumo, Jakarta. Next. Yeah, introduction. Computer tomography scanners or CT scan is a diagnosis imaging support in the medical field. One of which is to calculate the volume of bleeding so that it can assist the clinician is making decision in performing drainage of bleeding that occurs. Bleeding volume play an important role in prediction mortality. The size of bleeding has relationship with the neurological deficit in determining the prognosis. Selection has an important role is established in a good diagnosis, and it is hoped that the measurement of bleeding volume will be more accurate. The purpose of this study was to examine the effect of selectiveness on the result of measuring the volume of bleeding and the effect of the shape of bleeding on the result of measuring the volume of bleeding, where so far we have never know the level accuracy of measurement, especially the volume of the bleeding. Please next. Okay, material and method. The material I use paracetamol phantom I made by myself with the content to sample as as if the bleeding was regular and irregular, is containing accurate volume is 29 cc. And next, I use dual source computed tomography. Please, next slide. This is the method. First, pentaverifin, they use the scanning with the DSCT. Next step in reconstruction image, divide to selectiveness 1 millimeter and selectiveness 4 millimeter. In selectiveness 1 millimeter, next step, the measurement, 3 measurement in regular sharpness and 3 measurement in irregular sharpness. In /4 millimeter, next step is 3 measurement in regular sharpness and 3 measurement in irregular sharpness. And the last step is analysis. Please, next. This is a figure and B is regular sharpness. Please, next. Okay, the result of the study indicate that the size of the 1 millimeter slit thickness, the regular shape, is 27.74 cc with standard deviation of 1.26, and irregular shape is 27.15 cc with a standard deviation 1.85, while the 4 millimeter slit thickness in the regular shape is 27.2 cc with standard deviation of 1.72, and in irregular shape is 26.24 cc with standard deviation of 2.76. Please, next slide. This is the research chart. We can see the model of irregular 1 millimeter and 4 millimeter thickness, and the mean 3 measurement is 27.15, 26.24, and this and the standard deviation you can see. Okay, please, next. Discussion on conclusion is bleeding volume play an important role in prediction mortality. The size of the bleeding has a relationship with the neurological deficit in determining the prognosis. So that is the accordance with several journals which say that a good measurement of bleeding is a thin slit thickness, and this study proved that a thin slit thickness and regular bleeding shape result in a more accurate measurement of bleeding volume, which this study has a standard deviation of 1.26. Next. Thank you for the time.
Thank you very much, Kelvin, for the wonderful presentations. So I think the second presenter is also more or less same topic with the first presenter talking about the bleeding. But as you enjoy the slides, the second presenter is having the experimental study, having their own phantom of paraffin, then calculate the size of the paraffin bleeding more or less with the hemorrhage or bleeding in the head. So there is no question in the chat box, and we are seeking Dr. Sudiono as Kemenkes to give the review. Time is yours.
Okay, thank you, Pak Gatot. Congratulations, Kelvin Halim. Yeah, wonderful presentations today. and your team. Yeah, congratulations. And I have a question to team that the situation today's measurements about the study about the measurements of bleeding have been done a lot, right? Even though this protocol have been used in daily practice, especially to radiographers,
Right.
right? Why do you use saying the paraffin in this case? Why you don't use the maybe patient to measure bleeding to this study? Thank
So
you.
the question, Calvin, from reviewer is that 1 mm or 4 mm for measure of the bleeding volume is really used by the radiographers in the hospital. The question is why you still having the paraffin phantom to measure the volume of the bleeding. Please, time is yours, Calvin.
Okay. I use paraffin to measurement volume bleeding, but the paraffin is I made by myself, and I know the true volume in the paraffin like 29 cc is a true volume. With if I use the patient, the patient, I don't know how many volume in bleeding in the head. In my research I need I need accurate actual volume, and I use normally routine protocol in I use in
So basically, Pak Sudiono, so the reasons why Kelvin having the Ventum with paraffin is just checking the accuracy of the volume, because the volume is he made by himself and he know what is the exactly volume of the bleeding, then scanning with the dual source CT scanner. If Kelvin using the real patients, then he might not know how much the real volume of the patient. So just checking the accuracy.
Okay, clearly. Thank you, Pak Gatot and Kevin. The last question may be in the result of the 6 slides, maybe I find the actual volume Kelvin make 29 cc for the research, and makes the data which are regular data with 27.74 cc, like this. And this is a difference actually, and the with the between result, the image, right? There is a volume missing. It means. So, what do you think about that? Can you more explain the difference, the actuality size with the maybe the image size?
Sorry. So basically, Calvin, so the question from the reviewer is, you made the volume of the paraffin phantom by yourself, you know exactly the volume, but once you scanning the ventum and you measure the regular and irregular size of volume, there is a gap between regular and irregular. So reviewer asking your clarifications why it is different.
In different and regular and irregular, regular is a pure. Can you give me my slide?
Yes, this is the slide, Pak.
In figure, please.
In figure, okay, in figure. And in what slide? This one? This one?
Yeah, yeah. You can see the irregular stiffness. It have not have punya sisi yang
You may can say in bahasa, Pak. We try to discuss with
bahasa. Iya. Untuk contoh perdarahan yang tidak baku atau tidak reguler itu terlihat ada bolong-bolongnya. Jadi untuk pengukuran itu jadi pas ngeroy untuk melihat volumenya, jadi agak tidak maksimal dibandingkan yang bentuk regular.
Oke, so jadi maksudnya Pak Sudiono, ini yang atas kan irregular ya, yang atas yang irregular, yang bawah itu yang regular, tadi itu kan. So 1.85 and 2.76 is irregular. 1.26 and 1.72 is regular, while the actual volume is 29 cc. So what is your clarifications, Pak? Because based on your calculations, sesuai dengan perhitungannya Kelvin, itu even nggak ada yang mendekati 29 cc.
Okay.
Or maybe you will give the clarifications that this is only the standard deviations or what? Because maybe here CC. Okay.
Okay.
Ya. Jadi hasil penghitungannya Kelvin itu bahwa kesimpulannya maybe the hypothesis is that there is no calculations which is the regular or irregular which is close to 29 cc. There is a deviation here. So the highest deviations is on the irregular calculations because the deviation is 2.76. Jadi mungkin kesimpulan sementaranya pengukuran irregular itu itu deviasi yang paling menyimpang itu pada pengukuran irregular karena ini faktor deviasinya paling tinggi. Mungkin gitu Pak Kelvin? Okay.
Ya betul. Jadi dengan pengukuran yang paling bagus adalah di seperti yang udah dijelasin di conclusion, is a good measurement in a regular shaft. Because the standard deviation is 1.26. If in percentage dipresentasikan in percentage is 0.0 under 0.05.
Yeah. So Pak Sudiono, just want to highlight Pak Sudiono. So based on the conclusions, this is need to verified by another journals actually, because this is the experimental study. So this study by Kelvin is proof that thin slice thickness and regular bleeding shape is more accurate than irregular bleeding volume measurements. But this still need to be confirmed with another journals or maybe another method of the next experimental study. I think that is our conclusion for the second presentations. So thank you very much for Calvin Halim and Pak Sudiono.
Yeah, thank you.
And we will award Calvin with a symbolic granting of certificates. Please asking help to Astrid to show the slide.
Thank you, Mr. Gatot. Thank you, Mr. Dian Sudiono.
Okay, once again, congratulations to Calvin Halim for the wonderful presentations today. Okay, ladies and gentlemen, we now continue our third speaker. So please welcome to the stage Anna Septiana. She will deliver the optimalizations of anatomy image on urography MSCT with nephrolithiasis case using KV variations in dual energy computed tomography DECT. Time is yours, Anna Septiana, maximum in 10 minutes.
Okay,
please.
thank you, Mr. Gatot, as the moderator. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. His Excellency, our reviewer, Dr. Sudiono, and the moderator, the great moderator of today, Mr. Gatot, and all of the participants of this Zoom meeting. Let me share our PowerPoint. Good morning, everyone. I'm hoping to find you in a good and health condition. So in this time, we would like to present our study entitled with Optimization of Anatomy Image on Urography MSCT with Nephrolithiasis Case using GV Variation in Dual Energy Compute Tomography or DECT. This is the theme of our research. Me, Anna Septiana STR, Mr. Gatot Murtiwibowo, SPD, MAPP-MSc, I'm so sorry, and Mr. Jeffrey Ardianto, MAPP-SC. Ladies and gentlemen, our presentation will be covered some sorts of information that are introduction, purpose of our study, material and methods, results, and finally the conclusion. This is the introduction. In the radiology, we usually hear about MSCT, almost multi-slice compute tomography. With the producing of dual source compute tomography, it can produce the new imaging technique. One of them is dual energy. DECT, or dual energy compute tomography, present the newest significant increasing in the compute tomography. There are many clinical applications of the dual energy CT. First, it can remove the image of bone in the carotid or peripolar run of CT angiography. The second is virtual image reconstruction. Then, quantity of iodine antidote in the solid organs, image of iodine or gas distribution in the lung, and the differentiating of nephrolithiasis, and the last is identifying of goal-topy. So the differentiating of nephrolithiasis is the one of the clinical application of dual energy CT. Our study's background is based on the conditions that the choice of giving urographic examination with the dual energy protocol has not reached agreement because it requires an in-depth study of the differences in image result from each of these GV selections. So therefore, the authors are interested in conducting research on which GV is effective in dual energy urographic CT scan with multi-slice compute tomography as the modality. Regarding of our studies background, it is clear that the purpose of our studies, first, to know is there any differentiation of image quality between KV variation 140 kV and SN 140 kV. And the second purpose is which one the better KV variation between 140 kV and SN 140 kV. Let we see the anatomy and physiology of kidney first. The left one, this is the healthy kidney, consists of minor and major lake, medulla, capsule, ureter, renal artery vein, interlobular blood vessel, and cortical blood vessel. Next, we see in the right one, this is the kidney with the kidney stones, or we say nephrolithiasis. There are 3 stones inside of these kidneys, stone in the ureter, major, and minor colic. The symptoms of kidney stone, there are severe pain on either side of your lower back, more vague pain or stomach ache that doesn't go away, then blood in the urine, nausea or vomiting, fever and chills, urine that smells bad or looks cloudy. Okay, we move to our material and methods. Based on the conceptual study, as can be seen on this slide, this kind of observation is quantitative observation. We use 6 samples. 3 patients had CT scan urography examination in 140 kV, and the 3 others using SN 140 kV in light tube. Image quality that have been scored: parenchyma, renal pelvic, colic, pelvico-ureter junction, ureter, and vesica urinary. And the aspect of the lesion clearing that have been scored is the detail of the stone, then the measure of the stone, the shape of the stone, and the material of the stone. As we know that with the dual energy combo tomography, we can to know about the material of the stone. The data analysis was done by give the score to the image by 2 radiologists and analyzed with man-Whitney test. Well, ladies and gentlemen, this is our results of our observation. The statistic result of man-Whitney test need to know. So we use this man-Whitney test to know about is there any differentiation of image quality in kV variation between 140 kV and SN 140 kV. We get p value less than 0.05. It means that actually there was the significant differentiation in using each kV variation, or we can say that HA was accepted. And the next result from the mean rank in man-Whitney test, we know that SN 140 kV was the kV variant that better than kV variation 140 kV. This is the picture of using SN 140 kV, and this is the picture we use kV variation 140 kV without SN. This is the man-Whitney test that I have said. P value is 0.01. This is less than 0.05. So the HA is accepted. And the second table, we know the value of mean rank. Everybody can see that the mean rank of 140 kV have 11 and SN 140 kV has 20 in the value of the mean rank. So we can know that SN 140 kV is the better kV variation. Last but not least, finally we conclude that there are differences in the quality of the anatomical image and the clarity of the lesions visually and statistically on MSCG urography with case of nephrolithiasis using variation of 140 kV and also SN 140 kV. And the beta kV variation in showing anatomical image quality and clarity of lesions on MSCT urography is SN 140 kV variation. Statistically, it can be seen from the mean rank value of SN 140 kV, which is higher than the mean rank value of 140 kV. Okay, that's all. Have a nice day and thank you. So the time I'll give back for the moderator.
Thank you very much, Anna. It's wonderful presentation. So this is also the typical of the experimental study done by Anna Septiana. I think there is one question. I think there is one question from the chat box sent by Alfredo, Simeon Alfredo, but that is out of the context of these discussions. Maybe Alfredo can connect directly to Anna Septiana. So he is asking about the dual energy. I'm sorry, there is a leakage of the sound. Please appreciate us to mute your microphone, please. So the question from Alfredo is the dual energy city versus dual energy with one single source of tube. So maybe you can directly connect with Alfredo, whether dual energy is done by 2 units of X-ray tube or dual energy done by only one of X-ray tube. So there is no question in the chat box, and I give it to reviewer to give insight. Times to Dr. Sudiono, SA MPes.
Okay,
Time is yours.
thank you, Pak Gatot. Mbak Ana Septiana, hello. Hello, Mbak Ana.
Hello, Mr. Dion. Is it my voice clear?
Just make it louder, please, Anna. Just make it closer your microphone to your lips, please.
Is this my voice is clear to you?
Yes, now
Mr.
it's very
Dion?
good. Now it's very good. Yeah.
Yeah. Okay, Anna. Okay, good presentations today. Congratulations to you, Anna and team. Anna, maybe before I ask you about something, maybe I have a suggestion for you about your presentation today. Yeah, a clear and voice, yeah, good for all, but maybe more better, yeah, than your slide, maybe font, yeah, font in the box and slide maybe too small, maybe and too more. So maybe you know that one slide maybe contain maybe 9 sentence, or one sentence contain consists of maybe 9 words. Yeah, maybe you can and the next time maybe. Yeah. Okay.
Yeah, thank you, Pak Sudiono. So Anna, so the insight from reviewer is actually talking about your slides. First is the font is too small. Okay. The second is too much, because you have the limited of time, but it's too many descriptions under the slides. So just for your information, Anna, that are presenting, not reading of slides. So please be aware that you can maybe make it more simple, not just reading the slides. That is the feedback from the moderator, from the reviewer. So you get the points, Anna?
Yeah.
Yes, I get a point for Mr. Dion. Thank you for the.
Thank you. Sorry.
Thank you so much.
Okay.
Maybe we came to meet together to know about this experiment, and then we can make the new experiment. Maybe
Okay, thank you, Anna. Maybe in the next time, you will good presentations. I have one question to Anna. Based on your research, or resume your research, maybe there is a difference between one 140 kV conventional maybe and 140 SN kV, right? Yeah, there is a difference.
Okay.
And what's the mean of this difference using the difference kV in your research, please?
Thank you so much, Mr. Dion. Can I to answer it, Mr. Moderator?
Yes, yes, please, please. You can answer reviewer feedback, please.
Thank you. The question is there any differentiation between using 140 kV in the conventional CD and SN 140 kV?
So Anna, sorry,
Actually, yes,
Anna,
Mr. Dion.
just to be clear for everybody. So SN is meaning what? Synthetic or what?
And the add of SN in front of the 140, it means filter in the CT scan that use.
Okay.
So because of this filter, the picture of the image of the CT scan can be more clear for the anatomic and clear for the lesion in this on my research, especially for prolithiasis. That's all, Mr. Dion.
Yeah. So actually the feedback from presenter is there is a nephrolithiasis. We expose with the 2 times of X-ray. The first is 140 kV. That is conventional one. And the second exposure is 140 kV with a filter. And am I right, Anna?
I wanted to say more about dual energy. Why I take the dual energy, especially for dual energy, is it can to differentiating the materials of the stone of the kidney. So it's not only about clear image, clear lesion, but also it can to take the information about what is the composition of this stone, what is the composition of the other patient's stone. It can to be seen of the information of the result of dual energy CT scan. That's all, Mr. Dion and Mr. Moderator.
Okay, thank you. One more question.
Yes, just 1 minute, Pak, please. 1 minute.
Okay,
One
okay,
minute.
thank you. Miss Anna, as you know that the study we joined in the international conference which are titled Legal and Ethic, right?
Yes.
Yeah. I know that your subject in the research as a passion to subject in this research, right? Yeah, about the legal, how about the ethical clearance in your research, Anna?
Okay, about the ethical clearance, I'll take this observation in the hospital, and I have the ethical clearance from the hospital, but the file of the ethical clearance I can't show in this Zoom. I'm so sorry, Mr. Dion. Before we take this observation, what we call just like ethical clearance, we have to what we call, kita harus mengurus ethical clearance before we use the examination or before we done or we work this examination. So thank you, Mr. Dion.
So in summary, that Anna has been done for ethical clearance process, and approved by the board of the ethical members in the hospital, so this experimental study can be continued and done by the Anna. Am I right, Anna?
That's why
Okay.
I just take 6 patients, Mr. Dion. CT scan have so much difficulty on observation because we come to take so much patient, and I just only 6 patients on my observation. That is my difficulty in my observation. Thank you.
Thank you very much, Anna. Thank you very much, Pak Dion. And then on the chat box, is comment from Hidayat AS that the filter at the tube X-ray is the chemical elements. Okay, that is the comments from Pak Hidayat, and maybe Anna can continue discuss with Pak Hidayat about this point. So once again, thank you very much, Anna. Thank you very much, Pak Dion, and seeking your help from Astri to show the certificates awarding for presentations.
Okay, thank you so much for all of the people in this room, especially for Dr. Dion, Mr. Gato, and Mr. Hidayat Agsabarude in the chat room, and all of the participants. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Once again, congratulations, Anna. So let's continue our discussions. For the next presenter, I will invite Andi Nur Intan Wulandari. Andi Nur Intan Wulandari will presenting the dual energy subtractions technique for detections COVID-19 on chest radiograph. Time is yours, maximum in 10 minutes, please. Andi Nur Intan Wulandari, are you there? I call you once more. Andi Nur Intan Wulandari, are you there? Okay, let's recall Andi Nur Intan Wulandari for the later of the discussions. I will jump to the presenter number 5, Puspa Pamela Suci. Are you ready, Pamela?
Yes, I'm ready, sir.
Okay, so Pamela will deliver the amniotic fluid index detections with the ultrasonographic examinations at Babelan 1 Health Center, Bekasi. So time is yours, Pamela, maximum in 10 minutes, please.
Okay, thank you very much for the chance. Assalamualaikum warahmatullahi wabarakatuh. My name is Puspa Pamela Suci, and at this time, I would like to presenting. Sorry for my network interrupted. Maybe the committee can help me for sharing my presentation. Okay, yeah, that's right. Well, I would like presenting my journal based on my script start 3 years ago about amniotic fluid index detection with ultrasonographic examination at Babelan 1 Health Center, Bekasi. Okay, next. And amniotic fluid index. Amniotic fluid index must be examined in every pregnant woman in all trimesters. Earlier detected makes the faster treatment. And the most effective modality for this examination is ultrasonography. Why? Because this is the most non-invasive and accurate and cheaper, of course. And this research study was held in September till October 2018 at Babelan 1 Health Center, Bekasi. And here we use from 30 samples, and we get 16 number of normal, 11 alert to oligohydramnios, 2 oligohydramnios, 1 alert to polyhydramnios and 0 case of poly. And this method using descriptive qualitative with purposive random sampling technique. Yes, please. Amniotic fluid index, it must be an examined routine for first, second, and third trimester. If the value is as normal, the fetal development will interfere, and oligohydramnios in pregnancy and oligohydramnion with pregnancy make some baby infantment. So the pregnancy here with oligohydramnios has a high rate of meconium aspiration, fetal distress, and cesarean section. And hydramnios, idiopathic fetal anomalies, diabetes, or maternal gestation. And the range of abnormality between here is 2 till 8 for single pocket at first trimester, and between 5 till 25 at 4 pocket technique method for second and third trimester. Yes, next please. And material and method used in this research is descriptive qualitative research method, and it was beheld in September to October 2018 at Babakan Health Center, Bekasi, 10 sample of first trimester, 10 sample at second trimester, and 10 sample at third trimester, with and without complaint. So this is the pregnant woman who have medical checkup routine at there. And this is method using single pocket and 4 pocket technique with transabdominal scan with 2 till 5 megahertz curve probe. Single pocket usually used in first trimester and 4 pocket usually used for second and third trimester. Next, please. And the result we got here is from first trimester, 3 case of normal, 6 alert to oligohydramnios, 1 case of oligohydramnios, 0 case of alert to polyhydramnios, and 0 case for polyhydramnios. Total is 10 sample. And from trimester 2, we got 6 point of normal, 2 case of alert to oligohydramnios.
Iya, enggak. Itu 270.
Okay, yeah. 1 case of oligohydramnios, 1 case alert to polyhydramnios, and 0 case for polyhydramnios. Total is 10 sample. Third trimester, normal case is 7, alert to oligo is 3, oligohydramnios is 0, alert to poly is 0, and poly is 0, and total 10 sample. So for total from trimester first, second, and third in all sample is normal 16, alert to oligo is 11, oligohydramnios is 2 case, and alert to poly is 1 case, and we found nothing in polyhydramnios, which total is 30. Next, please. And this is the picture of normal and abnormal. At the left side, this is the normal case with a single pocket technique using at the first trimester. Can we see here the amniotic fluid level is enough, not more or not lack, and the picture below is oligohydramnios. So we can see all the differences. And the right side is 4 pocket single method. Okay, 4 pocket single method. The normal is picture above, and the oligohydramnios of it 4 pocket single method. Can you see here at the picture below? Okay, next. Okay, the discussion of this journal is the weakness of this research are only uses 30 samples. does not use a quantitative research method and does not use a data processing application like PLS, SPSS, or something like that. Yeah, but however, the effort of this study to find a standard operating procedure to be established through a proof that the measurement of the amniotic fluid index is very necessary and also can be underestimated. The early detection of amniotic value means faster of the treatment, of course. So the rate of fetal defect and maternal fetal mortality can be reduced. And the position and volume of amniotic fluid in each pregnant woman is varied. So the amniotic fluid index should be measured clearly and detailed in order to able to produce accurate information. Next, please. And here the conclusion is standard operating procedure of amniotic fluid index for each ultrasound patient in every pregnant woman are very important because if amniotic volume not detected, it could be the risk for safety of the mother or fetus by using single packet and 4 packet technique method. And the future research is expected to have more sample, longer research time, and using application data analysis. So the better and more accurate research results are to be obtained. And here's my reference. Thank you very much for your attention, and I give back to the moderator.
Thank you very much, Pamela. So wonderful presentation. So there is no question in the chat box, and I give it time to Dr. Sudiono S. Kemenkes to give her insightful feedbacks. Time is yours, Pak Sudiono. You still in mute, Pak Sudiono. I'm sorry.
Sorry. Thank you, Pak Gatot. Ya, hello, Puspa, Pamela.
Hello. Halo, Miss Ketion. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Okay. Your voice is clear and maybe I think it's okay. Your presentation is cool, yeah, wonderful, and congratulations to you and your team in this conference. Okay. Before I have a question for you, but firstly I want you to clarify with your five slide. You said that your participant or your subject study, but I know that your sample only 10. Please clarify this data.
Okay. Based on this data is 30 sample is collected by 10 first trimester, 10 in second trimester, and 10 in third trimester. Like that, sir.
Oh, okay. Maybe I have a suggestion that the result is good, your idea good, but maybe your presence, yeah, maybe in the third clarify 10, and then maybe in the sample, the same sample stand, and there your measure amniotic next the second semester, and then maybe a good at the 3. So the sample may be enough to 10 sample maybe. have serious data.
Yeah. So let me.
So you
Yes.
So let me clarify, Puspa. So the advice from reviewer is actually you taken the 10 samples at the different trimester, correct? 10 sample in trimester 1, 10 sample in trimester 2, 10 sample in trimester 3.
Yes.
Am I right?
Yes, that's right.
So the advice from the reviewer is in the semester 4, in the last semester, you need to add another 10 samples. That is my understanding. The second advice, you have to using the stations. Am I right, Pak Sudiono?
Yes, right.
Yeah, because if you are using the different patients, then the validity is you cannot responsible. You can have a valid result.
Kayak gini, Mas. Kayak gini lah.
Sorry, there is a breaking. Sorry, can someone appreciate us to keep your speaker off, please? Okay, so that is the advice from Pak Sudiono. So you have the same skill, use the trimester 1, 2nd, 3rd, and 4th semester. That is the advice from Pak Sudiono. Am I Pak Sudiono?
Yes, right, Pak Gatot. I have one question to Puspa Pamela. What's the official about fetal measurement with amniotic? So I don't know what the methods are used to detect amniotic before, and what the maybe before enter the amniotic method. What's the method before the amniotic?
I think we have the two questions here, Puspa. So the first question is why so important we have to measure the amniotic fluid index? Why so? And before the amniotic fluid index measurements, what is the past technology used in the ultrasonography world? Question. Please, time is yours.
Okay, thank you, Fashion. And first, I would like why it is important, because before there's no, not more, but when pregnant women come to this health center, if the pregnant woman said there's no complaint, like I'm sorry, can you help me in English with rembes water?
Leakage of water.
Leakage, okay, leakage of water. So if they say no leakage of water, there's no measurement of it. But in my opinion, based on my my own story, when I was pregnant, I have no complaint at all. I have no complaint. I have no rembesan. I have no cramps. But check me. They said it's only gohydramnios. And I have some medication for that. And I think it should have, must be a standard operational procedure. So when you go to checking pregnant woman, actually just only for the weight or the height, but not every examine use amniotic fluid measurement. And I asking too for my mother. My mother is a midwife, and I said how to measure the amniotic fluid. They said it's a scale like meteran tukang jahit, like that, something like that. Just measure with palpation. So when midwife palpation the baby and feel the baby, or they cannot feel the baby. They cannot feel the baby, of course, if polygohydramnios. If they can feel the baby with only one palpation, soft palpation, it's oligohydramnios. And I said, how can you say if you cannot say the volume is, we cannot predictable it's oligo or polyhydramnios if there's no numbers.
Okay.
This is the theory.
Yeah. So basically, Pak Sudiono and all the attendees here, why we need to measure the volume of the anions. Let me just clarify first to Pamela that that is not leakage of water, but leakage of anion. So yang rembes itu bukan air, tapi yang rembes adalah anion. Okay?
Yeah.
So why is so important to measure the volume of the anions? Because even without any symptom, the volume can also reduce inside the uterus.
Yeah, that's right.
And that is the dangerous for the baby, correct?
Yeah, that's right.
That is the baby. That's the dangerous of the baby. And in the past, there is no method to measure the volume of amnion without the ultrasound. So that is clarifications from Pamela, and I would like to suggest all the women in this Zoom meeting that you can ask your doctors or your sonographers to measure the amnion volume within semester 1, second semester, third semester, and the fourth semester. That is the conclusions for our discussions today. Time is up, and let's congratulate Pamela for the wonderful presentations, and we are seeking help from Astrid to show the certificate slides, please. Okay, once again, congratulations to Puspa for the wonderful presentations, and we go for the next presentations. I will call, I will call Arif Usmanto. So, Arif, are you there? Arif?
Iya Pak, semenit Pak.
Okay, so Pak Arif Usmanto will deliver the paper presentations with low dose thorax CT examinations in COVID-19 patients. Is it ready for Pak Arif? Okay, let's jump for the next sessions. We will recall Pak Arif for the later of these presentations sessions. So, Panji Wibawa Nur Cahyo, are you ready, Pak Panji? Pak Panji Wibawa Nur Cahyo, are you on the line of Zoom meeting today?
Yes, thank you, Mr. Gatot.
Are you ready for presentations?
I'm ready.
Okay, ladies and gentlemen, now we invite to the stage Panji Wibawa Nur Cahyo. He will deliver the plain abdominal photo quality with and without lavements in hydronephrosis patients. Time is yours, Panji. Maximum in 10 minutes, please.
Thank you for the time, Mr. Gatot. The Honorable Mr. Dr. Sudiono as a reviewer, moderator at International Health Conference, and the seminar participant. Thanks to the postgraduate Poltekkes Kemenkes Semarang who have organized this seminar. We share our PowerPoint. Please allow me to present the result of my research entitled Plain Abdomen Image Quality on Case of Hydronephrosis. Introduction and some research explain this theme. The first is DACA 2 in 100 80 sick patients were divided into two. One group have given castor oil and at the face. The other group was not. There was no difference in constipated patient. And number two is Guo, published in the Journal of Urology. 200.
Recording in
low in
progress.
fat and increased fluid consumption, and the administration of lactative is only as a complement. In some circumstances, such as patient old age, the patient has been hospital for a long time and chronic constipation, this lactative is absolutely necessary. One type of patient preparation is lavement to stimulate colonic peristalsis so that you can defecate so that the colon is clean of feces. How about lavement effect? Why in patient preparation of intravenous pyelography different between outpatient and inpatient at Professor Dr. Margono Soekarjo Purwokerto Hospital? The difference is in the presence or absence of lavement in the morning before the examination. The study aims to determine the plain abdomen image in patient with and without lavement. Method, this type of research is descriptive research. Research subject are plain abdomen image of the radiographic examination patient on case of hydronephrosis at is January to September 217 in Professor Dr. Margono Soekarjo Purwokerto Hospital. The sample of this study was the population that meet the inclusion and exclusion criteria of the study. The inclusion criteria of this study were PNO IVP examination patient who still had medical record data. The exclusion criteria for this study were PNO IVP examination patient with age 50 years. Plain radiograph will be assessed by one radiology specialist using a questionnaire according to the criteria for plain radiograph according to the European Commission guideline for evaluation of radiographic image and the assessment criteria determined by the research. The criteria include visualization of the urinary tract area from the upper pole of the kidney to the bladder base. Number two, reproduction of the renal outline. Visualization of the psoas line, visualization of the bone system. Each object is assessed with criteria invisible with score 1, visible score 2, and very clear score 3. In addition, the visualization of lot of air and feces for the proximal and distal colon also assessed with the criteria of visible and interferes with the diagnosis score 1, visible but does not interfere with the diagnosis score 2 and invisible score 3. This example of radiograph outpatient and inpatient. I have 20 the result and discussion. Assessment criteria outpatient, one visualization of the anterior urinary tract area number of radiograph score 1, 4, and 1 to visualization of the enterounitary tract area. And the reproduction of the right and renal outline, 2 radiograph score 1, 3 radiograph score 2, and 1 radiograph score 3. Reproduction of the left renal outline, 2 radiograph score 1, 2 radiograph score 2, and 2 radiograph score 3. Then visualization of the right psoas line, 1 radiograph score 1, 1 radiograph score 2, and 4 radiograph score 3. Visualization of the left psoas line, 2 radiograph score 1, 0 radiograph for score 2, and 4 radiograph score 3. And the last visualization of the bone system, score 1 and score 2 is 0, and 6 radiograph score 3. Then assessment criteria to the in-patient radiograph, visualization of the tract urinary tract, 1 radiograph score 1, 4 radiograph score 2, and 1 radiograph score 3. Reproduction of the right renal outline, 1 radiograph score 1, 4 radiograph score 2, and 1 radiograph score 3. And this criteria in-patient radiograph have more high score than outpatient. Reproduction of the left renal outline have 1 score 1, 3 radiograph score 2, radiograph score 3. At in-patient have a high score, more high score than outpatient. Number 4, visualization of the psoas line give a same score, and visualization of the left psoas line have same score, and visualization of the bone system have same score. In patient installation, figures total score for renal outline reproduction compared to the in-patient installation for either the right or left kidney. The renal outline may be obscured by superposition of image in air or bowel in transverse colon and air in the small instance. The in-patient installation have a lower total score for the right psoas line visualization than the outpatient installation, but give the same score for the left side. The appearance of the psoas line may be disturbed if there is a lot of air intestine and air and feces in the large intestine. In-patient installation have a lower total score for bone system visualization than outpatient installation. This criteria outpatient visualization of air and feces in proximal and distal colon. Their assessment criteria radiograph in patient
Recording in progress.
colon and then visualization of lot of feces for the proximal colon in patient have more score than patient.
Anji, sorry that you have 1 minute left.
Oh, okay, Mr. Gatot. In the in-patient unit has a higher total score for visualization of air and feces than outpatient unit for proximal colon, while the distal colon has some score. In the distal colon in-patient installation that show air and feces interference with diagnosis than outpatient installation. This can be due to the time span of the left ferment action with the examination
Recording in progress. Recording in progress.
Before I ask you about one question or two questions, we have note in my paper. Mas Panji, I think your presentation or PPT may be reduced or repair the PPT. PPT, I think, to small words. And how many words in the and sentence in your PPT? Maybe you can reduce. I think a good presentation if you are not reading only, but explain your idea. And maybe that may take time. You can reduce your words in the PPT or others. Yeah.
Thank you, Pak Sudiono.
And
thank you, Pak
I don't know
Sudiono.
was that the research. Okay.
Yeah.
Okay.
Thank you for the advice, Pak Sudiono. So the mentions the points number 1 to Panji that your slide is too much, Pak Panji.
Okay.
Within 10 minutes, you have to reduce the number of and to understand which one important to be shared among the attendees. You don't need to show all your slides, because personally, I also cannot understand when you showing the tables when you were trying to scoring the patients. I don't understand what it does it means. But the message from Pak Sudiono is first is your slide is too much. The second is don't read the slides. You have to share your idea. That is a point, Pak Sudiono.
That's right.
Thank you.
Okay, the next.
Thank you, Pak Dr. Sudiono
The
and
next.
Mr. Gatot.
Okay, Pak Panji, maybe you see the fourth slide. I don't know what your research conducted. What is the conducted research? Is a survey or maybe experiment? Mr. Gatot said that the research conducted by experiment, but I don't know. So that research done with the experiment, I don't know. Can you tell us about that, Mr. Panji, please?
Yes, Pak Panji.
Okay,
so Pak Sudiono asked you because your title of presentation is X-ray for the plain abdomens with and without lavements. So the question to you, that is truly experimental study, or you just taken the pictures when the patients come to the hospital? So please give your clarifications, Pak.
Okay, thank you. I'm sorry, I'm not good at English, so let me use Indonesian to answer the question.
Please, Pak, please.
Oke. Untuk penelitian ini bukan true eksperimen, jadi tidak memberikan intervensi apapun terhadap objek, hanya mengambil data secara retrospektif dari rekam medik yang ada di instalasi radiologi begitu. Karena memang di situ sudah ada dua perlakuan yang berbeda terhadap pasien yang rawat jalan dan rawat inap begitu.
So hope that is clarified to you, Pak Sudiono. This is not truly experimental study. This is just study on the retrospective study with the existing patients.
Yeah, I confused that you, Mr. Gatot, say the experiment. I don't know. Well, experiment. I don't know. So that the study will has conducted with experiment. I think there's a survey maybe, but retrospective data maybe. Okay, right? Okay, thank you, Pak Gatot and Pak Panji. And then, if this research conducted by the survey, maybe how many sample do you have, Mr. Panji?
Okay, thank you. Januari sampai bulan September untuk pengambilan data dilakukan pasien dari Januari sampai dengan September 2017 itu diperoleh 181 pasien untuk IVP. Kemudian setelah memasuki kriteria inklusi dan eksklusi, beberapa pasien sehingga tidak bisa digunakan karena yang pertama tidak ada medical record-nya. Yang kedua itu bukan kasus hidronefrosis, dan yang ketiga usianya itu kurang dari 50 tahun. Jadi memang di sini ditentukan kriteria inklusinya memang untuk hidronefrosis dan usianya di atas 50 tahun.
Oke, thank you.
Jadi hanya tinggal kurang lebih 12 radiograf.
Okay. I think that is the feedback Pak Sudiono, so from Pak Panji. So in interest of timing, we should move on. So I think there is notes from Pak Sudiono asking about the sample of exam. It's about 180 plus patients survey by retrospective study at the 2017. So I think that is of the end sessions of these presentations. Appreciations and congratulations to Pak Panji, and I call to Astri to show the certificate of appreciations.
Thank you, Dr. Sudiono and Mr. Gatot.
Okay, once again, congratulations to Panji Wibowo Nurcahyo for the wonderful presentations. And now I would like to invite the next presenter will be Franciscus Herianto. Franciscus Herianto is already on the line of Zoom meeting.
Yes, Mr. Gatot.
Yes, the topic will be ethical problem in the screening process of the magnetic resonance imaging examinations. Time is yours, maximum is 10 minutes. So you still mute your microphone, Franciscus. Just turn on your microphone, please. So that is right. You're showing the slide, but you still mute your microphone. Can you? Yeah, we can hear you.
Okay.
Yeah, just showing the slide, Pak, please.
Thank you, Mr. Gatot. Good to everyone. My name is Francisco Serianto, and my partner in this paper is Mrs. Reni Puspitasari. We want to present our paper about the ethical problem in the screening process of magnetic resonance imaging examination. It's a non-invasive radiation-free method of presenting images of organ for various slices without disturbing the patient body. MRI can provide diagnostic information with a high level of accuracy. The MRI room might become a dangerous place if the radiographer or another medical staff neglects to perform screening MR examination. MR examination, MRI is a diagnostic radiology scanner. Produces cross-sectional images of the body using magnetic field and radiowave energy, even though there are no radiation effect, such as CT scan, medicine, or conventional radiology. The MR room can be a dangerous environment if the safety guidelines are not followed. Patient lack of education and can lead to a variety of issues, including accident. The use of ferromagnetic implants or raised objects such as pacemaker is one of the most significant possible dangers for someone undergoing an MR examination. So please make sure asking about the patient history and then, for example, about what surgery they did or what other medical treatment they did. And then the safety of the patient is one of top priority. Because what? When the accident happened, it is too late for us. There is no time to go back. Material method. The type of research used is a library research, defined as a research related to library data collecting methods or research subjects carried out using various library information. Research literature or literature review is the research that critically examines or reviews the knowledge, ideas, or findings contained in the body of academic-oriented literature. Formulate theoretical and methodological contribution to a particular topic. Here are some cases resulting from the MRI screening failure. This is the first one. On this first case, during a brain MR scanner, a projectile from sent back behind the patient body injured a unconscious patient. MR officer forgot to perform a metal press scan on the sandbag. The second case, a 32 years old man died after being pulled by MRI scanner at a hospital in India. According to reports, due to the MRI officer attempts in relaying information regarding the MRI room location. The man attempted to carry an oxygen cylinder into the hospital for his brother, who was scheduled to have an MRI examination. The third one, during an MRI examination, child was killed in an accident. The pediatric patient oxygen saturation decreased. The anesthesiologist requested that the nurse who wasn't on the MR team bring an oxygen tube into the MR room. The magnetic field power of the MR from the oxygen cylinder into the MR room when it struck and killed the patient pediatric. Discussion. MR officer and other medical personnel must ensure the patient and the families are well aware about the procedure and restriction on the MR room. Medical equipment containing metallic or ferromagnetic element prohibited for MRI must be removed from the patient's body. And the last, in particular, those who use metal implants should be examined by giving informed consent both orally or in the writing. Conclusion. The magnetic field produced by MRI is so powerful. It can evac any nearby metal object. And to avoid the accident, MR safety screening must be performed, as well as a detailed explanation about patient history. Most of the accident occurred because of medical staff failing to follow safety guidelines. So when safety guidelines are obeyed, MRI is one of the best and safest imaging methods. Thank you very much. Give it back to you, Mr. Gatot.
Thank you very much, Francisco Sarianto, for the presentations. So there is no question from the chat box, and now the time given to reviewers, Dr. Sudiono, Kemenkes, to giving your insightful feedback. Thanks, yours, Sudiono.
Okay, thank you, Pak Gatot, and thank you, Francisco Herianto and team. Good presentation, and congratulations to you and your team. Okay, I have a suggestion to you and team maybe. After this your article or presentation, I know that the research conducted by the literature review, right? Hello.
Yes.
Franciscus. It's right that the research conducted by the literature.
So Franciscus, the question from the reviewer is asking you, so your paper is literature review, correct?
Yeah. Correct.
Correct, Pak. Pak Sudiono?
Correct, sir.
Pak Sudiono, seems we are losing you, Pak. So we seeking apologize for the all attendees, presenter, and also observer that we are losing Pak Sudiono from the line of Zoom call. So please, I'm asking help from the committee to contact Pak Sudiono to rejoin the Zoom meeting. Pak Sudiono. Mbak Astri, Mbak Hilda, you are on the line of this Zoom meeting.
Yes.
Yeah, we are seeking your help to contact Pak Sudiono because we will continue our sessions. There is still 3 presenters will deliver the presentations. Please asking your help to contact Pak Sudiono.
Yes, sir.
Yeah, so ladies and gentlemen, sometimes the technology is make us more easier of life, but sometimes also even harder of life. So this is just the example, the use of the technology where sometimes it's not easy. We have to depend on the technology. We have to depend on the network. We have to depend on the something else. So this is the beauty of technology. Always have 2 different sides. There is a positive and there is a negative. So we are experiencing the technical challenge now. We are losing Pak Sudiono from the line of the discussions. So while he is a very important person that we seeking help to give us a feedback. So I think give me time to call the committee because we should continue or we should postpone this kind of discussions because if we are continue the discussions without any review from the reviewers, then I think I will ask the committee first. So once again, seeking to apologize for the inconveniences. Thank you. So please stay tuned with the Zoom meeting. I will call the committee. Thank you.
Perkembangan perubahan wajah kota Semarang yang semakin indah membuat masyarakatnya merasa semakin nyaman di kota yang merupakan ibu kota Provinsi Jawa Tengah. Politeknik Kesehatan Kementerian Kesehatan Semarang merupakan salah satu politeknik kesehatan yang berada di Provinsi Jawa Tengah yang berdiri sejak tahun 2001. Program Pasca Sarjana Politeknik Kesehatan Kementerian Kesehatan Semarang diawali pada tahun 2015. Politeknik Kesehatan Kementerian Kesehatan Semarang dipercaya sebagai satu-satunya politeknik kesehatan di Indonesia yang memiliki program pasca sarjana Magister Terapan Kesehatan.
Visi program pasca sarjana Kemenkes Semarang adalah menjadi institusi penyelenggara program pasca sarjana Magister Sains Terapan Kesehatan berbasis kearifan lokal dan diakui di tingkat nasional dan internasional pada tahun 2025. Sedangkan misi program pasca sarjana adalah satu, menyelenggarakan pendidikan pasca sarjana yang menghasilkan lulusan kompeten dan berbudi pekerti luhur untuk memenuhi kebutuhan pelayanan kesehatan di tingkat nasional dan internasional. Kedua, menghasilkan karya penelitian kesehatan terapan dan berkontribusi nyata di dalam pembangunan kesehatan. Dan misi ketiga adalah menghasilkan karya pengabdian masyarakat berbasis hasil penelitian dan permasalahan kesehatan. Dan yang misi keempat adalah mengembangkan kemitraan dengan berbagai institusi pemerintah dan swasta di tingkat nasional maupun internasional untuk meningkatkan kapasitas lembaga di dalam pengembangan ilmu pengetahuan dan teknologi.
Program studi yang ada di lingkungan program Pasca Sarjana Magister Terapan Kesehatan Politeknik Kesehatan Kementerian Kesehatan Semarang, yaitu program studi Magister Terapan Keperawatan, Magister Terapan Kebidanan, Magister Terapan Imaging Diagnostik, dan Magister Terapis Gigi dan Mulut. Kualitas pelaksanaan pendidikan dan pelayanan yang diberikan oleh program Pasca Sarjana Magister Terapan Kesehatan dibuktikan dengan didapatkannya akreditasi A untuk program studi Magister Terapis Gigi dan Mulut, serta akreditasi B untuk program studi Magister Terapan Keperawatan, Magister Terapan Kebidanan, dan Magister Imaging Diagnostik oleh Poltekkes. Tersedianya fasilitas berupa perpustakaan, ruang pertemuan, ruang diskusi, laboratorium masing-masing program studi, laboratorium kebidanan meliputi laboratorium postnatal care, laboratorium antenatal care, laboratorium intranatal care,
So we recall again our reviewer. Dr. Sudiono as Kemenkes.
Hello,
So,
Pak Ketua.
yes, Pak. So, yes, we are waiting your advice, Pak Sudiono. So, the last discussions is that the presenter confirmed that the paper is based on literature review, Pak. So, we are seeking your advice. Just only one advice, Pak, because we still have a 3 presenter in the line. Thank you, Pak.
Oh yeah. Okay, I think enough for me to Mr. Francis apa ya? Apa tadi satu?
Francisco Herianto, Pak.
Francisco Herianto. Actually, I have a question with to Franciscus. Can I have a time, Mr.
Please,
Kato?
Pak, just 1 minute.
Oh, just 1 minute. Okay. Okay, thank you. Franciscus, this is a literature review, right? And I don't know sure that you how many article do you have? I don't know source. And then how do you get article? I don't know sure that you can tell me, and how do you select your article? I don't know source, and in this session maybe I want to explain more about that.
So, Francisco Herianto, there is a 3 question from the reviewers. Pak Sudiono asking how many literature that you review, how many. The second is how you search the literature and how you select. That is the question. Please, time is yours to answer the question, Pak.
Thank you very much. Actually, the one who chose our paper for what should we select is Mrs. Reni. And then how many paper for the literature? Let me count. Maybe about more than 10.
Okay.
Sorry.
So you are searching 10 literature.
Yes.
Okay, as a reference, correct?
Correct.
Okay. Then who is choosing the literatures, Pak? Is the
one is choosing the is Mr. Reni.
Mr. Come again?
Miss Reni Puspitasari.
Okay, so Miss Reni Puspitasari. Okay, so how you select the paper, Pak? Because you have 10, then decide by Reni, and how you select the paper, Pak? How? Just browsing in the internet, then maybe you have comparing one paper and another one paper. So what is your answer, Pak?
From Miss Reni answer, she find on Google Scholar.
Okay, so basically, Pak Sudiono, so the author of this paper is searching under the Google Scholar, and they are finding the 10th paper, and they are presenting today, but the presenter presenting only the 2 cases. One is sandbags, and one is the accident in India, which is cause of the death of the patients, Pak.
Okay.
So that is the answer from the presenter, Pak. Thank you very much for Francisco Herianto and Pak Sudiono for the insightful discussions. And would like to congratulate to Francisco Herianto and the friend and the team, and would like to appreciate once more, and congratulations to Francisco Herianto. Okay, ladies and gentlemen, so we still have the 3 presenter despite of the timing. So we still have presenter. So I would like to seeking help from the next presenter that you have maximum 10 slides because you only have 10 minutes. Don't more than 10 slides because that is will be running out of times. So now I would like to invite Adi Sismadi to present the paper about the lung dose CT scan LLDCT as a screening test in patients who will be hospitalized. So, expecting Adi to present in maximum 10 slides within maximum 10 minutes. Time is.
Okay, thank you, Mr. Gat. Oke, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Alhamdulillah, my name Adi Sismadi and sorry. This is my team, Mr. Hidayat Asabarudin and Miss Mila Vidiani. I say many thanks because I get opportunities to present our paper about low dose CT scan, or we say LLDCT, as a screening test in patients who will be hospitalized during pandemic. This is a clinical benefits and medical ethic literature review. About the abstract, in the background, we review from clinical and ethical a screening strategy LLDCT scan for patients who will be hospitalized during of the pandemic. In method, we review procedures, techniques, clinical benefits of LLDCT scan, examination, justification, and ethics of its application. And then we collection of various literature related about LLDCT scan examination to obtain conclusion from a clinical and a medical ethic perspective regarding the COVID-19 screening strategy. In the result, we review the various literature collected, so LLDCT scan can the COVID-19 screening strategy in patients who will be hospitalized, as well as screening strategy for lung cancer patients. And then clinical review provide information that the examination carried out resulted in very low radiation dose, which is below 3 milligray of CTDI, with high image quality and accurate for COVID-19 clinical information. And the examination procedure is carried out by obtaining consent from patient or family patient by signing the informed consent. In conclusion, LLDCT scan examination as a COVID-19 screening in a patient who will be hospitalized can be applied by paying attention to ensure the examination is carried out low dose CTDI less than 3 milligray and the result of image to enforce the COVID-19 diagnosis. And the review of legal medical ethic, LLDCT scan examination does not conflict with medical law, where the examination is carried out based on the consent of the patient or patient family, and not solely for business interest and seeking profit. About the introduction, we know about COVID-19, yeah. And then in Indonesia, from 3 January 2020 until 11 November 2021, there have more 4 million confirmed cases COVID with 140 deaths. COVID-19 induced phenomena diagnosis should be verified by RT-PCR as brain mass, chest or lung CT scan was suggested to be a satisfactory tool for detect COVID-19 phenomena based on report from China showing a sensitivity of up to 97%. Low-dose CT scan is approved for screening lung cancer with adequate quality. LED CT scan screening is examination once lung with has more low radiation dose that conventional lung CT scan. Key of goal of the healthcare system in response to COVID-19 outbreak are to reduce morbidity and mortality and minimal disease transmission, protect healthcare personnel, and preserve healthcare system functioning.
So sorry, Pak Adi, in the interest of timing, you can just skip the introductions and you can go with your study, Pak.
Yes, okay. In the method related chest CT scan examining technique, we know the LED CT scan technique use cases COVID-19 both as screening effort to diagnostic effort to ensure patient is positive COVID or not. And some other literature complete we used to complete the information about related LED technique with lung cancer patients. And then the analysis reviewed the clinical benefits and medical ethics, especially to relation the lung low dose CT technique that can be used as a COVID-19 screening test. And then we also discuss a result of information clinical and radiation dose obtained by patient after LED CT examination. About the result, August 2020, all patients with COVID-19 has characteristic CT feature is in a disease process as a different degrees of ground glass opacity with and or without crazy paying sign, multifacial organization phenomena, and articular distortion is a very pale distribution. Modgal et al. In the study provided evidence that lung low-dose CT scan can provide excellent information on the description phenomena due to COVID-19. Regarding radiation dose, value in study was 1.77 milligray, and the result study taking et al. Demonstrate a specificity of 93.6% for detection COVID-19 with low dose chest CT, marked higher than result gathered in recent meta-analysis by Kim et al. Low dose CT scan, which is usually lung cancer screening test, turned out to be a good tool for detection COVID-19 pneumonia. The discussion LLD CT scan demonstration for sensitivity, specificity, positive prediction value, and negative prediction value, and accurate for the diagnosis of COVID-19. Their aim at helping and trying to find alternative tests more fast and still accurate for diagnostic purpose, ensuring that the patient is truly positive or not. ACR should not be used to screen for a first-line test, a diagnosis COVID-19, and CT should be used sparingly and reserved for hospitalized symptomatic patients with specific clinical indication for CT. Appropriate infection control procedure should be followed before scanning subsequent patients. Intermedical ethic must obtain the consent of the patient before the examination is carried out, and then considering radiation reception and additional costs to be borne by patient. because that before a pandemic, patient who will be hospitalized do not need screening examination. And then we have to open and clear verbal explanation to patient or his family is very necessary to ensure that the patient understanding what will be done to him or his family. The conclusion, clinically, by considering accuracy, sensitivity, and specificity given can be allowed. However, quality control and supervision of radiation protection must still be required, must be a low dose. And in term medical ethic, the approval of the examination patient and the patient family must be carried out. Two things can be done. The lung low dose CT examination, COVID-19 screening for patient who will be hospital may be carried out. This is a reference. Thank you.
Thank you very much, Pak Adi Sismadi, for delivering literature review for these sessions. So before I give time to reviewer to give the insight, so I'm really encouraged the next two presenter, which is Andi Nur Intan dan Pak Arif Usmanto. Please, you still have time to customize your slide, maximum in 10 slides, please. Okay, so we only have 10 minutes and I'm expecting you to customize your slide is only maximum in 10 slides. Now, I give time to Pak Sudiono to seeking advice and insightful feedback. Thank you, Pak.
Thank you, Pak Gatot and Pak Adi Sismadi and team. Yeah. I received the PPT not seen which one present is the Gatot, so I confused. Received the information from Pak Adi Sismadi. Yeah, I received the PPT not the same with the presentation today. So I maybe sorry with if we wrong in my question. Sorry. Okay. Pak Adi. Okay. That is it conducted with literature review, right?
Yes,
yeah.
Sir. Yes.
Okay. As far as I know that the LLDCT is a protocol, right? In CT scan machine.
Right.
Yeah. Yeah. Okay. And that the not all the CT machine have a protocol LLDCT, right? And I ask you about this situation. What can you suggest if CT scan doesn't have the protocol LLD, but the patient maybe in the era pandemic COVID, more and more cases in maybe in a region or in the hospital. What can you suggest if CT scan doesn't have the protocol LLDCT?
So Pak Adi Sismadi and team, so we have the text from the reviewer that on the reviewer understanding, the LLD lung dose CT, lung low dose CT is a protocol. Then how if the existing CT scan in the hospital doesn't have the lung low dose CT? So that is the question, Pak. Thank you.
about the
Yes, sir.
protocol low dose, that is only several hospital have developed COVID-19 screening strategy to avoid make a patient are safe and free for COVID-19, doctor. Because with LED CT scan below 3 milligray, it is a less radiation dose, because that several hospitalized take that protocol, doctor.
Thank you very much, Pak Adi. So we have your team, Pak Hidayat, raise a hand. So please, Pak Hidayat, if you want to adding the informations, please.
Yeah. Thank you very much, Mr. Gatot. I will try to make answer about the Pak Sudiono question. The LLDCT, this is a right. This is a protocol, but every system, every CT scan, every CT scanner have this protocol. This is just make customize and make just adjust the protocol to make the low dose scanner to low dose examination, and it's mean every scanner can be do the LADCT for thorax CT. Thank you.
Thank you, Pak Hidayat, and our reviewers. So that is the feedback from this presentations team. So the clarifications is that lung low dose CT can happen in any CT scan in the hospital. So that is just matter of we are customized and we are optimize the protocol to get the lowest possible of the radiation dose to the patients. So that is the end of this sessions. I would like to congratulate and thank you to Pak Adi, Sismadi, Pak Hidayat and team. And I would like seeking to Astri to show the certificate appreciations. So once again, congratulations to Adi Sismadi for the presentations. So ladies and gentlemen, so we continue with the next presentations. I will recall to Andi Nur Intan Wulandari. Are you on the line of Zoom meeting? Okay, I will recall you with 2 times from now. Once again, Andi Nur Intan Wulandari, are you on the line of the discussions? Once again, Andi Nur Dari, are you on the line of discussions? Okay, now I give to Pak Arif Usmanto to share your presentations. So Pak Arif will discuss and present about the low dose CT thorax examinations in COVID-19 patients. Time is yours, Pak Arif Usmanto.
Yes, thank you, Pak Gatot, for the time. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone.
Waalaikumsalam warahmatullahi wabarakatuh.
Thanks for time for us to present our journal with the title Low Dose Thorax CT Examination in COVID-19 Patient, with author me, Arif Usmanto, and my colleagues Nova Adelina and Wilda Wahyuni from Department of Imaging Diagnostic Poltekkes Kemenkes Semarang, Indonesia. Okay. Coronavirus disease 2019 is called COVID-19. Is an infectious disease caused by several acute respiratory syndrome. Corona 2 is called SARS-CoV-2. This disease has been identified since March 2020 and has become a health problem in the world and including in Indonesia. Okay. The challenges is how to detect the COVID-19 early and effective. So important for fast response for the treatment with a patient like this. The screening COVID-19 potential to repeat it for assessment about the how to develop the progress of the after the treatment with the patient COVID-19. Yeah. At the beginning of the arrival of the COVID-19, it's a very limited detection of the tool like the PCR and others that can be used. So for this reason, is the necessary to hospital to maximize the existing tools so that they can provide the alternative with all modality in hospital to help this pandemic. Research belong to the category of the filtration research and then conducted by direct observation in the field of the obtained information related to screening and evaluation of the examination of the COVID-19 patient as the radiological imaging and intervention radiology section of the Bogor City Hospital. It was observed in March until June 2021 and category of the qualitative research which intend to understand the implementation of the screening and evaluate activities for the COVID-19 patient by describing their implementation. The COVID-19 virus causes acute respiratory illness called the pneumonia. The characteristic symptoms of the pneumonia caused by coronary like fever, fatigue, dry cough, and dyspnea, or like the shortness of the breath. Various ways of the medical diagnosis of the COVID-19 can be done to detect case of the COVID-19. This method of the medical diagnosis of the COVID-19, including in clinical characteristic and radiological diagnosis. The radiologist diagnosis involves the computer tomography atau CT scan, yeah, and then chest CT and chest X-ray if CT scan is not available. Symptoms of the COVID-19 can be detected effectively using the CT scan image with the pneumonia like the appearance. Based on the CT scan, radiologists can detect pneumonia, COVID-19, and evaluate the patient state of the recovery after treatment or the at the deterioration. And based on the deep stages in the chest, CT scan is generally recommended for the detection of the patient infected with the COVID-19. This is the image, the CT scan is marked for detect pulmonary abnormalities in COVID-19 cases. Can be used low dose from the start when patient with the COVID-19 indication come to the hospital, first line. This method will also be beneficiary for the health team on the duty so that they can carry out the proper self-protection from. The finding on the chest CT scan are generally more clear than on chest X-ray. Yeah, finding that can be found on both examination are finding of GGO like the ground glass capacity, and then of the bilateral consolidation, both focal and multifocal, especially with the distribution in the periphery and posterior lower lobe of the lung. This slide consists some image CT scan with the low dose, and we find about the A is after 3 days with the COVID-19. We find the early presentation, a small region of the subpleural GGO with partial consolidation was demonstrated in the right lower lobe. And then the B is after 7 days with the COVID-19, there was an enlarged region of GGO with superimposed inter and intralobular septal thickening with partial consolidation. And then C is after 11 days with the COVID-19, we find the partial resolution of the initial GGO with new area subpleural consolidation. And then the last one is the D, is the after 20 days with the COVID-19, and then continuous resolution with minimal residual GGO and parenchyma band in of the birds. Yeah. This image from Lodos finding the progress after get the treatment about GGO is consolidation have been decreased. It's very clear. Conclusion: the Lodos City protocol at the Lodos below in 10 milligray is can produce the some pre-screening result as the standard dose protocol, favoring the use of the low dose Thoraxity as the routine protocol. And then the difference in the city number Hornfield unit range is a high between organ in the lung cavity, so such as the air having an Hornfield unit between minus 800 and bone having a Hornfield unit between plus 300 until 1,050, 1,500. Then the high MR is not required to display this difference. Thorax CT scan examination for suspect the COVID-19 with the patient is more screening initial diagnosis, and the COVID-19 positive patient in the CT scan of the thorax can be repeated. Yeah, for the repeated several times to using the CT scan to show the how about the progress after the treatment like that. Because the examination can be repeated just like thorax CT low dose examination is one of alternative, one of alternative examination used for the screening and evaluation of the COVID-19 patient, and we know the patients of the recovery after the COVID-19. This is the reference, and then thank you for the attention. Mr. Gatot, I'm done. Thank you.
Thank you very much, Pak Arif Usmanto, for the wonderful presentations. So we give it time to our reviewers, Pak Sudiono. We have time for 3 minutes to seeking your insight. Time is yours, Pak Sudiono.
Ya, terima kasih Pak Gatot. Thank you so much, Pak Gatot, and thank you Pak Arif Usmanto. How you do, Pak Arif?
Yes, fine, Pak. Still working, Pak.
Okay. Congratulations, Pak Arif and team. We've done the presentation today with the title Low-Dose Thorax and TB expansion in COVID-19 patient. Yeah. Okay, good presentation. But I'm sorry that I have received the your article today and PPT maybe, and so I'm also so sorry that many wrong on my review.
Yes, Pak.
Yeah. Okay. Sorry. Yeah. Okay. Pak Arif and team. As you know that the radiographer guidance in making imaging based on G standard, as far I know, firstly, the imaging image or to diagnostic, and the second based on the radiation, and the third based based on the maybe a dollar. So radiographer called the 3D. The first D is by diagnostic, and second D by diagnosis, and the third D refers to dollar, right?
Yeah.
Yeah. Okay. As far I know that the low doses have effective and disadvantage in the patient, especially on the thorax CT, right?
Yeah.
Yeah. What do you think about HRCT, Pak Arif, when compared with to low dose protocol?
Yeah. Okay, Pak Dion, thank you for the question. Your question. I'm trying to answer your question, and then in the CT machine, we always to get the protocol test, normal test, and then you can see for the test normal or test routine, you can find to image to image. One is the mediastinum. You can see the mediastinum first, and then the other one you can see the condition lung condition. Ini the routine protocol. You can get the normal protocol. Otherwise, and you can see, get the HRCT, high resolution CT. You in the high resolution CT, you get the protocol is different with the CT routine, CT routine. You can find about the different with the choice of the collimator, or collimator is some like the particular with the detector with small detector, and then the other one you can get of metric, different of metric, and then different metric, and then you can get the high LCT with the axial scan and helical scan. But in this long low dose chest CT, we get from the maybe routine, and then we modify about the protocol first, and then you can get the estimation about the how much dose the patient will receive after that, and then you can set about the protocol below 10 milligray, and then you can get image only lung condition. You cannot see about the lung mediastinum chest, mediastinum chest, because it's very low dose. So you can only get the lung condition for the evaluation about the COVID-19.
So Arif, sorry to
yes.
jump in, Arif. So the question from reviewer is actually asking you, what is the difference between the high resolution CT versus the low dose CT? Maybe you can just give a brief summary. What is a difference between those two of different technique?
Okay, for the acquisition is same, Pak. For acquisition is the same, but the protocol is different. Yeah, protocol is different. HRCT, you can choose some different collimation for the detector with the HRCT, and then low dose lung CT. That one.
So in principle, HRCT and low dose CT is the major difference is on the radiation dose to the patients. Am I right, Pak?
Yeah.
So
yes.
the HRCT most likely having the higher dose for the patients compared with the low dose CT.
Yeah. Yes,
Okay,
yeah.
what is the
Yeah,
major difference between HRCT and low-dose CT?
Yeah.
Maybe we can continue discuss later what is in technical detail, what is the parameter difference between low-dose CT and HRCT. So I think that is the end of sessions for the presentations today. So I would like to appreciate and thank you to Pak Arif Usmanto and seeking Astri to show the certificate appreciations. Please.
Thank you, Pak. Thank you.
So Astri, can you help to show the appreciation certificate? Once again, congratulations to Pak Arif Usmanto for the wonderful presentation today.
Thank you. Thank you, Pak.
Okay, ladies and gentlemen, before we come to the end of sessions, we as a team, myself, Giovanna, and also Astri, would like to thank you and appreciate to all presenter, reviewer, and participations for the wonderful discussions today. This time, I would like to announce for the best paper, for the best output result, and the best oral presenter to receive the rewards. So please be ready. Now is award sessions. So for the best award, I would like to congratulate to the best paper winner number 3. Congratulations to Arif Usmanto. Yeah, so that is the winner number 3 for the best paper with the low-dose CT thorax examinations in COVID-19 patients. So for the best number 2, congratulations to Nabila Pramitya Putri. Implementations of slice thickness of head CT with traumatic brain injury case. Then the best number 1 for the paper, I would like to congratulate jeng jeng jeng.
Iya, sebentar ya saya.
Congratulations to Puspa Pamela Suci with the amniotic fluid index detections with the ultrasonographic excisions at Babelan 1 Health Center, Bekasi. Congratulations, Puspa. Can I see Puspa is still on the line of discussions? Puspa, are you still on the line? Okay. He is not, she is not, and I would like to continue the awards again. So the best number 3 for the output result winner award to Anna Septiana. Optimalizations of anatomy image on urography MSCT with nephrolithiasis case using KV variations in dual energy computed tomography. The best output result winner number 3, congratulations to Adi Sismadi, lung low dose CT scan, a screening test in patients who will be hospitalized during pandemic. The last one, best result winner number 1. The best output result winner number 1 is congratulate to Kelvin Halim. Volume measurements analysis of bleeding in phantom with dual source computed tomography DSCT in RSUPN Dr. Cipto Mangunkusumo. Ladies and gentlemen, that is the awards today. We will sending congratulations certificates to all attendees, success for the presentations, best output result, and also best paper for today. You will get an email regarding the rewards. So the last one, I will appreciate to one candidate for the best oral presentations. The winner number 3 for the oral presentation given to Adi Sismadi. Congratulations, Adi. The second is Nabila Putri. And the last one is the best oral presenter given to, congratulations to Puspa Suci, amniotic index detections with ultrasonographic examinations at Babylon 1 Health Center, Bekasi. Ladies and gentlemen, so and by I would like to seeking all the presenter approval that your paper will continue proceed as a proceeding together with nursing, midwifery, oral health therapists, and will publish by Poltekkes and become the property of Poltekkes proceeding collections. So if you do not agree, then you have to proceed by your own arrangements to publish your proceeding. So please raise hand if you are not agree with the plan or you still need clarifications. Please raise your hand. So I'm seeking all the presenter all agree to proceed by the Poltekkes for the proceeding and publications. Okay, I assume all the presenter is approved to continue with proceeding and publications by Poltekkes. Ladies and gentlemen, we come to the wrap-up sessions now. Myself and all the crew members would like to apologize for the technical problem and any inconveniences that you might experience during this conference. So I thank you once again for your participations and wish you all in a good health. See you in the 3rd International Health Conference by Poltekkes. And last but not least, in the main room sessions now is already passed. You have two choice. You can leaving the rooms and end of the sessions today, or you still can come back for the main Zoom. This is the end of the sessions today and the breakout rooms imaging diagnostic sessions. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Kauzunulet, terima kasih, selamat. Bagus, Pak.
Terima kasih semuanya.
Mbak Puspa lagi
Thank you all.
Terima kasih Pak Dio, terima kasih Pak Gato.
Ya,
Terima kasih semuanya.
Pak Dion, terima kasih Pak Gato.
Ya.
Terima kasih Pak Gato, terima kasih Pak Dion.
Sama-sama.
Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih Pak Gatot.
isi emot. Ada di sebelah kiri gue, ini tangan, oh iya, silence. Gimana rasa di terus kalau
I'm sorry to ma'am and share. Don't forget to back to main room. Thank you.
Recording in progress.
Insan dunia, ekspresikan
Halo semuanya, perkenalkan kami dari Sound of Nursing Poltekkes Kemenkes Semarang ingin mempersembahkan lagu yang berjudul Ampar-Ampar Pisang dan Takkan Menyerah. Silakan menyaksikan.
Apa yang kau tahu tentang semua yang akan terjadi? Tidakkah kau yakin pada dirimu? Angkat kepalamu, hidup tidaklah seburuk itu. Berjuang untuk semua hal yang berarti. Dan biarkan semuanya berlalu. Dan jika beban hidupmu takkan
Halo semuanya, perkenalkan kami dari Sound of Nursing Poltekkes Kemenkes Semarang ingin mempersembahkan lagu yang berjudul Ampar-Ampar Pisang dan Takkan Menyerah. Silakan menyaksikan.
apa yang kau tahu tentang semua yang akan terjadi? Tidakkah kau yakin pada dirimu? Angkat kepalamu, hidup tidaklah seburuk itu. Berjuang untuk semua hal yang berarti. Dan biarkan semuanya sendiri dan sering merenungkan apa yang mungkin terjadi dengan hari ini ataupun nanti, dan biarkan semuanya berlalu. Dan jika beban hidupmu takkan ada terbayang, semangat rintangan kehidupan ini jadi pemenang. There's no need to worry anything anymore. Everything will be fine as long as you believe it. There's no need to worry anything anymore. Everything will be fine as long as you believe it. Dan jika beban hidupmu takkan ada terbayang, semangat hadapi rintangan kehidupan ini. Dan jika beban hidupmu takkan ada terbayang, semangat hadapi rintangan kehidupan ini menjadi pemenang. Bari-bari.
Semarang hebat, Semarang memikat. Kota Semarang adalah salah satu kota metropolitan terbesar di Indonesia. Harmonisasi sejarah dan akulturasi budaya yang selalu dijaga, diiringi dengan perkembangan perubahan wajah kota Semarang yang semakin indah, membuat masyarakatnya merasa semakin nyaman di kota yang merupakan ibu kota Provinsi Jawa Tengah. Politeknik Kesehatan Kementerian Kesehatan Semarang merupakan salah satu politeknik kesehatan yang berada di Provinsi Jawa Tengah, yang berdiri sejak tahun 2001. Program Pasca Sarjana Politeknik Kesehatan Kementerian Kesehatan Semarang. Diawali pada tahun 2015, Politeknik Kesehatan Kementerian Kesehatan Semarang dipercaya sebagai satu-satunya politeknik kesehatan di Indonesia yang memiliki program pasca sarjana Magister Terapan Kesehatan.
Visi program pasca sarjana Poltekkes Kemenkes Semarang adalah menjadi institusi penyelenggara program pasca sarjana Magister Sains Terapan Kesehatan berbasis kearifan lokal dan diakui di tingkat nasional dan internasional pada tahun 2025. Sedangkan misi program pasca sarjana adalah satu, menyelenggarakan pendidikan pasca sarjana yang menghasilkan lulusan kompeten dan berbudi pekerti luhur untuk memenuhi kebutuhan pelayanan kesehatan di tingkat nasional dan internasional. Kedua, menghasilkan karya penelitian kesehatan terapan dan berkontribusi nyata di dalam pembangunan kesehatan. Dan misi ketiga adalah menghasilkan karya pengabdian masyarakat basis hasil penelitian dan permasalahan kesehatan. Dan yang misi keempat adalah mengembangkan kemitraan dengan berbagai institusi pemerintah dan swasta di tingkat nasional maupun internasional untuk meningkatkan kapasitas lembaga di dalam pengembangan ilmu pengetahuan dan teknologi.
Program studi yang ada di lingkungan program Pasca Sarjana Magister Terapan Kesehatan Politeknik Kesehatan Kementerian Kesehatan Semarang, yaitu program studi Magister Terapan Keperawatan, Magister Terapan Kebidanan, Magister Terapan Imaging Diagnostik, dan Magister Terapis Gigi dan Mulut. Atas pelaksanaan pendidikan dan pelayanan yang diberikan oleh program Pasca Sarjana Magister Terapan Kesehatan dibuktikan dengan didapatkannya akreditasi A untuk program studi Magister Terapis Gigi dan Mulut, serta akreditasi B untuk program studi Magister Terapan Keperawatan, Magister Terapan Kebidanan, dan Magister Imaging Diagnostik oleh Poltekkes. Tersedianya fasilitas berupa perpustakaan, ruang pertemuan, ruang diskusi, laboratorium masing-masing program studi, laboratorium kebidanan meliputi laboratorium postnatal care, laboratorium antenatal care, laboratorium intranatal care, dan laboratorium pelayanan holistik. Laboratorium keperawatan meliputi laboratorium kegawat daruratan, laboratorium perioperatif, dan laboratorium keperawatan kritis. Laboratorium terapis gigi dan mulut meliputi laboratorium Oral Health Prevention Program, Laboratorium Management of Oral Health Promotion and Prevention Program, Laboratorium Oral Health Promotion based on gamification, tutorial room, dan 3D printing room. Laboratorium Teknik Imaging Diagnostik meliputi Visual and Communication System room, ruang USG 3 dimensi dan 4 dimensi, laboratorium fluoroskopi, dan berbagai fasilitas penunjang lainnya yang membantu memaksimalkan pelaksanaan kegiatan pelayanan dan pendidikan yang dilakukan di program Pasca Sarjana Magister Terapan Kesehatan Politeknik Kesehatan Kementerian Kesehatan Semarang. Magister terapan
Sandarkan lelahmu dan ceritakan tentang apapun aku mendengarkan.
Jangan pernah kau merasa sendiri. Tengoklah aku yang tak pernah pergi.
Bagiku engkau tetap yang terbaik. Entah beratmu turun atau naik.
Kadangkala tak mengapa untuk tak baik-baik saja.
Kita hanyalah manusia, wajar jika tak sempurna.
Saat kau merasa gundah, lihat hatimu percaya.
Segala sesuatu yang boleh bisa di
The closing ceremony is going to start in a moment. Please be ready. aspect of health services. There was already a panel session. Now, we will close the. I would like to now call upon our head of postgraduate program, Poltekkes Kemenkes Semarang, and for this occasion, it will be delivered by Assistant 1 of Postgraduate Program, Poltekkes Kemenkes Semarang, to present us with the closing speech and ceremony. To Dr. Ariswondo, MPH, the time is all yours.
Thank you, Ms. Ki. Our distinguished speaker, moderator, reviewer, and participant. Good afternoon for all of you. Assalamualaikum warahmatullahi wabarakatuh. We have been just through an excited and very productive process. For the past 2 days, we have deliberated on a wide range of global issues concerning the legal and ethical aspect of health services during pandemic. We have had a speaker from Thailand, from University of Chiang Mai and University of Gothenburg, Sweden, that present their government regulation faced to the legal and ethical consideration. All of them important and some of them crucial to the life of our movement. On behalf of our head postgraduate program of Health Poltekkes Semarang, allow me to express sincere appreciation to Dr. Sri Sumarni and the team, and also Ms. Taki, Ms. Dita, Ms. Umi, Sinta, Rosa, and Ilut. Yes. And also the supporting Mr. Brian Stastama and Mr. Rodi. All of them contribute to the very successful international health conference. I would also say many thanks to head of a department and to the host, coordinating by the RD and his friend, who has prepared place and everything we need to carry out this program. Please forgive us for the mistakes you might have during the conference going on. We do hope to see you all in the next program. Goodbye, everybody, and see you then. With saying Hamdallah, this International Health Conference is officially closed. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, sir. Now our conference is officially closed. Now I would leave you with a quote by Stuart Brand, an author and innovative thinker who once said, "We can see the past, not influence it. We can influence the future, but not see it. Let us all be guided by all the things we have learned and heard throughout the conference and be able to see and influence our future." Thank you, and thank you very much. And before we apart, please accept this verse from us. Kalau ada jarum yang patah, jangan disimpan dalam peti. Kalau ada silap dan salah, harap sudi maafkan kami. Which roughly means, please forgive us for all shortcomings. Till we meet again, perhaps in the next conference. May all of you have a great day. Billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Semarang hebat, Semarang memikat. Kota Semarang adalah salah satu kota metropolitan terbesar di Indonesia. Harmonisasi sejarah dan akulturasi budaya yang